AMUSEUM Art Science in the Sharing Thoughts എന്ന webinar series ആണ്. Today we have a webinar on Mumbai mission to tackle COVID-19 in Mumbai. A team of medical volunteers volunteered from Kerala, collected around 60 to 70 people of doctors and nurses, and they are still, most of them are still working at Seven Hospital, Mumbai. So I invite all the panelists, moderator Dr. Iqbal, who is already the chairperson of the expert committee of COVID management in Kerala. So I would like to invite Dr. Iqbal to take over this session as the moderator of this webinar. Thank you. Sir, mic off on. Sir, the mic off on.
Good evening, friends. I am indeed extremely happy to be with you this evening to participate in the sharing of thoughts of the Museum Thought for Art Science session, where my young friends will be sharing their experiences in the Mumbai hospital. And before that, let me first of all congratulate all those young friends who went to Mumbai to help the Mumbai patients in their most trying of times. In fact, we are passing through a period of great crisis in the midst of a pandemic, an unprecedented pandemic, and affecting more than 200 nations. It is reported that it affects about 230 nations. Now, such a situation cannot be handled by a single nation or a state within a nation. In fact, we are now talking about planetary health. We can get out this pandemic only if the last person is free of this pandemic, the influence of this pandemic. So international cooperation, solidarity is extremely important. And we see excellent examples of such international solidarity, starting from the Cuban doctors who went to Italy, one of the richest nations in the Europe, and from Cuba, which is still under the threat of various economic lockdown by the United States of America. But the young doctors from Cuba went to Italy and helped them to tide over the crisis. Not only that, they went there with their drug which they are trying now, the interferon alpha. And that was an excellent example which all stimulated us an international cooperation and solidarity. And also we see at the international level other movements like the open source COVID movement. This is again large number of scientists, technologists all over the world are cooperating with each other to develop COVID technologies, not only software but also hardware, without being monopolized by multinational corporations. So such a movement is there. It's also an excellent example. And coming to our country, you know that the Serum Institute, the pioneer institute in producing vaccines in India, is cooperating with the Oxford University to develop a vaccine. And they have now reached the human trial. And now the young states have gone to Mumbai, and Maharashtra is one of the most affected state in India. We go there to offer succor and help to them Now, this is a process by which we share our experiences, also learn from them. In fact, we had interacted with Santosh Kumar, who organized this. The expert committee invited him for a discussion in our night session, and from him we learned that Kerala has to learn a lot from Mumbai hospital situation, especially in terms of managing the severe cases. So he has given a detailed note to us, and we have given it to the state government. So you see that we have not gone there to teach them. We have gone there to learn from them also. So this is a mutual exchange of ideas, mutual learning process. And we are all in a mood of a learning process. We are confronting a new virus, new disease, and every day we need to learn something new. So such sharing of experience is extremely important. And I hope that it will further motivate other youngsters to offer solidarity to whoever is requiring solidarity. Even in Kerala, you know that one of the affected area is the coastal area. And fisher folks are one of the most marginalized people in Kerala. In fact, they came to give succor to us during the time of flood without even asking for them. Now they are suffering, and the Kerala people should definitely try to help them out. So similarly, so between nations, within nation, between countries, within states, and within state, the vulnerable and the non-vulnerable. So such a mutual help and solidarity is extremely important. And you have set an example, and we are all really proud of you youngsters. And we hope that your example will be emulated by others. And I am here not to chair this session, more to hear you and learn from you. Now let me finish by saying that I am chairing the expert group set up by the government of Kerala. We have 11 of them. And in fact, every day, I am telling you very frankly, every day I learn something from the youngsters in our group. Because I am the oldest person in the group. But I can tell you very frankly, for the last 30, 40 years, I am very active as a clinician as well as in the public health field. But last 6 months, I learned more public health from the youngsters of the states and other parts of the world. So my hope is with the younger generation. I am sure that we will be able to tide over this crisis also. Thank you very much for inviting me to chair this session. I would like to hear you more than to talk to you. Thank you very much.
Thank you, Dr. Iqbal, sir, for giving us such a nice introduction and giving us a nice words and being so interested in learning from us. First, we'll go to Mr. Rohit Krishnan. He is a staff nurse. He has been working in Mumbai even before the crisis. He was working there, and all throughout the crisis he has been working there. And he'll be talking about his experience and how he went through and how he is still working there, and he's actually planning to work there furthermore, even when the doctor's coming back. So I invite Rohit Krishnan to give his words.
Thank you, Santosh sir, and thank you, Iqbal sir, and thank you, Ajay sir, for giving this wonderful opportunity to talk in front of you people. And about my experience, and still I am addicted to Mumbai. I am having an addiction. Once a person lives in Mumbai for 1 or 2 years, they will be having an addiction, and still I am having this addiction. That's why I told that I will be here in Mumbai till the COVID ends, and after that only I will be leaving the Mumbai. And I came with many dreams to the city, and as to work as a nurse, and I was working in nurse as in Safety Hospital Mumbai, and I learned a lot. I learned the basics of nursing and the tertiary, secondary, tertiary, everything from Mumbai only. So I'm so proud to be in this mission from the Kerala team. And I can tell about the condition of the Mumbai. Actually, before COVID, as we all heard that this Mumbai is one of the biggest cities in India, and we are having in Mumbai we are having one of the best medical treatment before and after COVID also, post and pre-COVID. and even foreigners come from other states, other countries to get the treatment, better treatment in Mumbai. And in the beginning of COVID, as every other countries did, they were also not conscious about what's going to happen next, and they were also not prepared for it. When we are comparing the Mumbai to the Kerala, because we want to learn all about it now. Because when we are comparing Mumbai with Kerala, our Kerala health sector, 80% of the health sector is under government setup, and we are having that community health center, sub center, that primary health center, and enough ASHA workers, USHA workers, all these things. But when you are comparing it to the Maharashtra, especially Mumbai, the thing is 80% of the health sector is under private corporate sector. So government's role in managing COVID was too less in the initial stage. So preventive aspect, they did nothing. That was the actual thing. They did nothing in preventive aspect. They opened one Kasturba hospital was there for the COVID hospital, and after that it was spreading. Even in Dharavi and other slums are there. Every in Mumbai there are slums, and in all these slums they did nothing. They didn't do anything. So from there it spread, and the local transport system in Mumbai was local trains. They were using more local trains than the buses. And when we are coming, when we can Google and see how rush it will be there in the local trains. Till the lockdown, they didn't close or they didn't do anything for the local train. They reduced the number of trains, and but still everyone will go for a job. But it was a rush, and from there I'm thinking it may spread in a higher stage. And uh, they what everyone did was they were only running short of beds, hospital beds. By the time lockdown came, and still we thought that it will come to control, but the things was opposite, and the cases were increasing day by day. Private hospitals shifted to COVID centers, and the hospital where we are working, Seven Hills Hospital, Mumbai, is one of the India's biggest COVID center, and it was the nodal center of the Mumbai. And here 1,300 beds. Before, this hospital was not running properly, and now it is shifted to completely COVID center. But still, we are having a shortage of beds. There were some mistakes. Actually, the thing was, here the government is having money, public is having money, everyone is having money to establish new hospital setups. But the thing is, here we are lacking human power, especially nurses and doctors, because Kerala is one of the biggest resource for nurses. And what happened is, in the initial stage, many staff nurses came positive, but they were not treated properly. And by that time, a big percentage of nurses go back to Kerala and other states also. And this is the reason why here we are facing that much nurses, shortage of nurses. And the health education system, if you're coming and going out, and if you're asking about COVID to a public, they are not that much aware about COVID. They are still in a question that is this COVID real or not. When I had an experience, when I go to a workshop, and I told him that I am working in a COVID hospital as a nurse, and he is telling me that is this COVID right or thing, because they are having a doubt that COVID is that it bring bought by the private hospitals to get the money. And the private hospitals are what they are doing is, with this time period, they are taking huge amount of money as deposits and the treatment money. And this way the private hospitals are doing a business. Then in between, now also there are many patients who are not getting beds for the treatment. And by that time, what these people are running short of bed, and many deaths were happened in the ambulance. In ambulance, due to shortage of bed, patients are not getting treatment. Due to the refusal of treatment, they are dying in ambulance. At that time, I got a call from my friend telling about Santosh sir and Mumbai mission. I just called Santosh sir and I told that, sir, I am going to be in the mission. And that's what about me in this mission. Right now, I am working with sir in the Seven Hills Hospital and doing well day by day. The cases are increasing still. We opened a 20-bedded ICU in Seven Hills Hospital and we are running it. And also our staffs are working in other wards at ICUs and all. So this is all about the initial the reason why I am in this mission.
Thank you, Rohit. I think we'll next invite Ms. Anu Devarajan. She's basically a engineer, is computer engineer, and she has been associated with us in several of the activities. She has been coordinating the all the human resources, especially the doctors, nurses, and it's like almost like 65 doctors and nurses who has gone there. So she has been coordinating all this from beginning and still coordinating it. So it's a very interesting aspect to know how we could actually coordinate all these doctors, young doctors and nurses, and get them there, and how they are actually working, the experience of coordinating. Please, Ms. Anu Devarajan.
Hello all, I'm Anu Devarajan. Actually, thank you for
Hello.
giving this opportunity to talk in this webinar. So actually, hello, can you hear me? Hello, can you hear me? Hello?
Yes, welcome.
Yes.
Hello.
Yes.
Oh, okay. Actually, okay.
Yes, we can hear.
So actually, okay, thank you. So actually, I am part of this mission. Actually, I start hearing about this mission from Dr. Santosh in some of her casual meetings. So I'm aware that such a mission is going to happen. And when the official letter from Dr. Tatya Rao Lahane, the COVID nodal officer in Maharashtra, came to Shailaja teacher, our health minister, and when at that time and all, I was thinking like it's a normal one. Some doctors, and there is no. I'm not. I'm thinking like I'm not involving in this. I'm just listening.
പണി കിട്ടിയ തെറ്റുണ്ട ഉറപ്പാണ് പാപ്പ പോയി പോസ്റ്റുള്ള ആൾക്കാർ പോയി പോസ്റ്റ് പോകില്ല
Post, and the same message was gone to several WhatsApp groups and all. And my number was given as the contact number for doctors. So I start getting, actually I'm flooded with messages and calls. And the most important thing is all the initial calls. The first 5 to 10 calls I got are from ladies, from females. So I became so excited because I was not expecting like this much girls will be interested in this mission. And all the majority of the girls who called that time, they were just passed out of their MBBS degree. They just completed their house surgery and they were waiting for the PG admission and everything. So I still remember the first call I got was from Dr. Monisha. I remember she's from Kollam, but unfortunately she can't join the mission because she got some PG allotment, and followed by a call from Dr. Chitra. Chitra was also part of our mission. So like that, I got many calls. Initially, it was all okay. Like it's all fine. I can talk to them. I can brief them, and later on, actually, I understand. What I understand is the first call I got, they had called personally. Like they didn't talk to their parents. They didn't talk to their family. Actually, these doctors are interested, and they called me. And there comes a task like they have to talk to their family, and they have to convince them. So my job became different. Like I have to convince the family, I have to convince them, and I'm a non-medical. So I used to call Dr. Santosh and Dr. Sajesh, and I used to get all the information about Seven Hills Hospital, how the COVID hospital is working, how the ICU is working. I learned about doffing, donning, and other infrastructure things, the staying options, food, accommodation, laundry, and everything. And I start investing like half an hour to 1 hour to each individual to tell them what's going on there. So actually, till that time, I was thinking like I can go on with my job. I'm an IT consultant, so I was thinking like this will be a part. I can. go hand in hand, these two things. But in the whole time of this, at least for 1 week, they traveled on June 1st. It's a team of 15 doctors, and then comes the problem, like the last minute, the airline have cancelled their trips from Trivandrum. From Mangalapuram and from Kannur and all, only from Cochin airport. The airport was full, and after they reach there, I can see the change in attitude. They all developed a rapport in between. They all start loving the working conditions there, the staying conditions there. Although there are few problems, they were all like okay. They were all in a good rapport and all. And after 1 week. Dr. Santosh has called me and asked, can you help Rohit? Rohit was coordinating nurses. So can you help Rohit in coordinating nurses? Actually, there are some problems with nurses, like nurses. Actually, 4 of our nurses have already traveled by that time. I have involved in that in raising e-pass for Suti. Suti was on staff nurse. Suti was traveling from Matanda. So she wants to get pass to travel from Tamil Nadu to Kerala. And so I helped her in getting the pass. And I talked to Ashwati, Vidhu, and Deep also who traveled that time. So after that, there comes the problem, like the nurses are facing a financial crisis to arrange to book their own tickets and to arrange the taxis to travel to Cochin. So there comes an option, like we will arrange a bus. The Maharashtra government will arrange a bus, and like that, the nurses will be traveling. But we need at least 20 nurses to travel. Then only it will be economically feasible, like that. So me and Rohit, we start calling each one of the nurses personally, and we started asking them, are willing to travel by bus, and we will fix a date for traveling and all. And finally, we got some 22 nurses willing to travel on a particular date, and I raised e-pass for them. And at this point of time, I like to remember additional district magistrate Vinod sir and TC Rajesh, journalist based in Trivandrum, and Dr. Ajit. Actually, Dr. Ajit was in this mission from the very beginning, and like that. So what happened next is, in the final minute, in the 11th hour, many of the nurses have backed out, saying many personal problems and citing so many reasons and all. And we have to schedule the journey with some 12 nurses. And the most memorable thing is, our bus have to travel the final time in the last minute. One of our nurses, Dr. Harsha has called Rohit and told like she is also willing to come. And so actually the buses travel some 75 kilometers, and she was in Trivandrum. So we asked the bus to go back to bring Harsha, because actually what we are thinking is like, at least if we are getting one more human resource, one more nurse or one more doctor, it will be helpful in the condition going on in Mumbai. So the bus turned back and traveled all these 75 kilometers to and fro of 150 kilometers, and like that we missed some stops and everything. Like actually we have scheduled to cross Kannur by 7:30, and we reached Kannur by 11 p.m. in the night. So like that we have traveled. We have organized that bus trip and all. So after that also, when the nurses reach there, they're also the same thing. Like as with doctors, the nurses also started loving the work at atmosphere there, all the conditions there, and they also generate a rapport in between them. But after that, after a week or so, I personally decided to travel to Mumbai because I want to see how it's working, how all these things are going on in Mumbai. Although what I saw that time was, although everyone is happy, there are confusions between them, like in between. Like initially they told us like provisional registration certificate is enough for doctors, but later they told like permanent registration is required, and we have to talk to Health University to get the permanent registration done. And then comes the problem with doctors who completed their MPPS from outside India, like from China and Russia. Actually, they have some more procedures to complete to get the certificates and registration certificates and all. So later on, we solved that issue also. We came to we talked to them and told them like, you only just initially told us like a provisional registration is enough, and we solved that issue. And later when I went there, what I saw that all are happy, but there are still confusions, like they didn't get the travel reimbursement. They were confused that whether they will be getting the remuneration. Especially the nurses have borrowed money. They have lent money from some other sources for the travel, those who travel by flight. There will be many confusions. Actually, when I went to meet nurses one day, actually there arise a talk like that. Like many of them with this financial and monetary things. They talked to me, and the talk, it was hugely depressed that day. Thinking like they talked to me like that. And I told Rohit, like, it will be okay. Even if I am in that place, I will be also behaving the same. Because although we are happy with the work atmosphere and all, it's equally important to get the monitoring needs also satisfied. So same thing happened with doctors also. And after that, now from 3 days, the remuneration they start crediting their remuneration to the bank account. So that things is also going on fine now. So personally, if I'm talking about the mission, what I gained from this mission is like, I never thought in my life like I will be involving in so many lives. Like I will be mobilized. I'm a software engineer, and I'm not into human resources actually. I never thought like I will be touching so many lives. I'll be mobilizing a team of about 100 people. I will be. Actually, I'm so happy. Now I'm so much sure. Like when you're talking to any of these doctors and nurses after 5 years, this 1 or 2 months will be the most memorable time in their life, and the more dedicated. And also I can see now like some of the nurses are pursuing a career in Mumbai. Even doctors also, some of the nurses and doctors are pursuing their career in Mumbai. They're start working now. Apart from this mission, they started working in Mumbai, and Mumbai is becoming a second home for many of them. Like that, I'm happy in that. This is the experience I gathered from Mumbai mission, and thank you for giving me this opportunity to talk.
Hello.
Hello.
Okay,
Yeah.
thank you, Anu
Thank
Devarajan,
you.
for this wonderful description you have given. Now, I would just say, being a part of this leader, maybe I don't describe myself as a leader, because I find everyone there in Mumbai, every doctor and every nurse has evolved as a leader of the mission, and the decisions are always taken in a democratic way, and there's not much things. It's more of my role rather was like a coordinating all those doctors and nurses and everyone. So I'll just say, I just want to say 3 points about 3 major issues about this one. One is really about how did actually I think Dr. Ajit can put on this slide, which will be really useful in this one. How what was the most important thing is that hello, can you hear me? Hello?
Yes, sir.
Yes.
Yes, you are audible.
Yes, that slide. So how swift the system overwhelming is being done. That's a slide I really want to look into. That's how the system overwhelming is done so fast. You can see that when we reached there, by me and Dr. Satish, when we reached there by 28, on June 1st, the number of cases was just beginning to rise. You can see that the number of cases were like in Mumbai and in Maharashtra, they were rising. To be precise, on June 1st, the death was in Mumbai was just 41, and by 10th or 15th, it has just reached 100. Almost like more than 50% increase in death rate just by 10 days. So we could actually perceive or feel the number of deaths rising by every day. Beginning of maybe like after 5th, we could me and Dr. Satish, though we were really new to the city, we were receiving like 25 to 30 calls every day by some other people who are not known to us, telling that we need a ICU bed and could you help us with a ICU bed, arranging an ICU bed and all. So you can see that the increase in death rate has so much is so fast. So this is a point which I really want to stress, because once the system gets overwhelmed, but what I mean is that when at that point of time, all the hospitals in Mumbai, there was not even one ICU bed available every day. So where people were actually running from hospital to hospital just in search of ICU beds. And that's why even our administrators were getting like hundreds and 200 calls per day just for an ICU bed. And all the people, all the influential people, right from the commissioners or the ministers and everyone actually running behind beds. So this happens in just 10 days. So this is very important, because the solutions to increase the solution is to increase the number of ICU beds. That will not be possible in a short time when we realize that this is going overwhelming. So the preparation has to, the main aim I would say is that the preparation has to start quite earlier, and maybe like it should start like months earlier. So we should develop some indices which can actually predict the system overwhelming at some point of time. I would rather say that the more than the number of positive cases every day, we should actually concentrate on the number of severely ill patients on every day, and probably the doubling rate of the severely ill patients. And on the other hand, we should actually try to calculate the effective ICU beds, and maybe like Dr. Sajesh would be saying more about the infrastructure and the quality of the ICU, but he's an intensivist. So we should actually look into the number of ICU beds with real quality to treat COVID patients. So on one hand, if we have this doubling rate of the severely ill patients, and on the other hand, if we have the number of ICU beds, we can actually calculate more or less. There would be some issues, like when we go for a lockdown in between, it might get delayed, or when there is a super spread, it might be just fast enough. But still, we can get how much time we will have in our hand to increase the capacities. That's one of the point which I really would like to stress. That maybe that's one of the lessons which we should actually learn. And the second thing I would really like to say is about the effects of lifting the lockdown in Mumbai. Actually, we were thinking that the effect of lifting the locking down would actually increase the number of patients coming to the hospital from Mumbai. But amazingly, it was not that. So surprisingly, it was not that. What happened was that after the 14, I think on March 8th, they lifted the lockdown. And we are expecting more patients after like 14 days, maybe like after 25th, we are expecting more patients. But what happened was really surprising, because the number of positive patients from Mumbai just came down. And what happens is the other satellites, the satellite cities like Thane, like Panvel, Kalyan, Dombivali, Vashi, and Navi Mumbai. All those places where the patients were coming more from these places, the suburban cities and the suburban the nearby districts. So what we presume is that when the lockdown was lifted, actually the poor people or the people who are finding very difficult to live in Mumbai just went out of the city and went to places where they were finding it very much more easier to survive. And survival is one of the most biggest issue for people migrating also. And this has actually what now the Mumbai faces is totally different thing. Totally different means the number of cases, positive cases in Mumbai is less. The number of death is again increasing, because the suburban districts or suburban cities or districts doesn't have much facilities like Mumbai. So all the people who are positive have including the patients who have positive, had moved out to these places. Now the cases are rising in that places, and when the severe cases comes, there is no place to treat even in this. So even from the all of the faraway cities, people are actually coming back when they are severely sick. They come back to Mumbai for again a ICU bed. So that's this is what has happened. So the migration of the people from a city, it could be due to a lifting of the lockdown, but it has surprisingly has increased the. Even I think that even in Dharavi, the people are just went away from Dharavi just due to fear or due to other reasons. And what has happened is that now the Maharashtra is having a drastic increase in number of positive cases. Yesterday it was 8,000, and when we went there, it was like almost like 2,500 on June 1st, and now it is like the number of cases is reaching up to 8,000. The day before yesterday, it has crossed 8,000, and the death rate is also again increasing very drastically in a very fast, swift manner. So that's an effect of the another issue I would like to stress. Third thing is that about the humanitarian nature of people from Kerala or from any other state. But I have been working with the Medicines Sans Frontiers and many other organizations for the last 20 years. And we have been doing a lot of campaign to mobilize people from here to work in other Africa or other places. But all these years, we were just able to mobilize only maybe a handful of people, maybe like 10 or 15 people only from whole Kerala. But when we started this mission, I was really surprised. Really surprised because like more than our team is like really huge, almost like 65 to 70 people is really huge. And even at this time of when we see our sentence എല്ലാവരും പറഞ്ഞ ഒറ്റ കാര്യമാണ്, പോയ എല്ലാവരോടും പറഞ്ഞൊരു കാര്യമാണ്, നിങ്ങൾക്ക് ഇങ്ങനെ എന്താണ് മരിക്കാനാണോ പോകുന്നത് ചോദിച്ചത്. ആ ഒരു that means are you going to die in Mumbai? That was a question asked by every friend of any of the relatives or parents to the people who came, doctors and nurses who came to Mumbai. So what was like they were able to cross this question, and just when they went through. So what made the difference? That's that's really surprised me. I really think that there are a lot of people even in Kerala. Maybe that we could not. This crisis has given them a bigger leverage or bigger thought that they should be really useful in a humanitarian crisis to other people. And maybe Africa is much far away place, or even like other places are much far away. Iraq or Syria is much far away place. We don't feel the issues or the crisis which those people face. But in Mumbai or in Kerala, I think we are close to the community. At least in Maharashtra, we have a big Malayali community, and they are really they are staying there for like generations, and they have we have a soft corner for them. And maybe I think that this is the most important thing, that now we could rise like 60 or 70 volunteers who can go to Mumbai and serve. That has made a huge difference, because all these years we were not able to mobilize just 10 or 15. Now in this crisis we were able to mobilize like 70 people, which is really much larger. So I just stop here, but I congratulate and I with the people in Maharashtra and people in all of the places who are suffering from disease. And I would like to express gratitude and my warm regards to all my doctors and nurses who have reached there and who are actually serving the people there in Mumbai. Thank you. There will be a small slideshow on Mumbai, like really useful to get a hands-on picture and feel out how this Mumbai mission went on and how the conditions in the hospital are there.
This is the usual situation of Mumbai.
slideshow is going to happen. Hello.
Hello, slideshow is going on.
Okay.
This is the food supply to the volunteers who are actually traveling to Mumbai.
Actually, can't
It's,
see
it's Ajit, it's not on.
Can you see the slides?
No,
No,
only the
just
initial one.
So shall we move the while this is set up?
No,
Shall move?
you can see, yeah.
Yeah.
Can you see now?
No,
Can
only
see,
you.
sure.
One second.
Okay. So in the meanwhile,
Can you see it?
no.
No.
Okay.
Santosh, could you elaborate on our government level, your Maharashtra government level involvement also?
No, I'll just call on Dr. Anish Raj, who has been still working there. I think that. Yes. Now we can see it. Okay. Okay, that's a picture from the I think from the airport coming down.
Hello.
And we can see that the poster of the nurses were coming in the destinations. Now we can see Dr. Anish and our doctors. There's a food being given by the DYFA volunteers to our nurses while they're traveling. And that's a whole team who have reached from the in Mumbai, where they've traveled all the way from Kerala to Mumbai. That's really wonderful. That's Padiyaram, yeah. And now they have reached this hospital. First batch of doctors have reached the hospital, and that's again the I think there's a hospital in the night. They came in late night. Yeah. They have come in the late night. The quarters are staying where they're staying. That's a Seven Hills Hospital. It's a huge hospital of 1,300.
It's hostel.
That's a hospital. It's a hospital.
Yeah.
That's a place in I think they're having a photograph in the
Anish selfie.
hospital. Yeah, selfie. Anish is having a selfie. And there's again
nurses team actually.
Yeah, it's just before the training program, I suppose. Yes. So that's again the nurses team. And there's an ICU inside. That's very interesting thing to see. So you can see all these equipments are independent. So maybe Dr. Sajesh can give much description.
This is a newly procured ventilators and BiPAP machines and everything. This is wide. Large number of ventilators. Actually, they have around more than 250 ventilators and more than around 200 BiPAP ventilators.
These ventilators are procured from the PM CARES fund. I think around 70 ventilators came from there.
Yeah. This is administration team.
Administration team. There's a
There's a hospital lobby.
This is hospital lobby actually.
That's
Our initial discussion and induction programs. This is intubation training program conducted by Anish, and this is laundry. It's a huge laundry department. This is a nurses team. Actually, Jisha, we can almost her height of. This is actually, you should just check, keep it. That is tocilizumab and remdesivir. For each tocilizumab costs around 40,000 rupees each dose, and remdesivir 6 doses total duration will be around 40,000. And we have given more than 20 actually only in our IC around 20-25. Anish knows that tocilizumab and plenty of remdesivir remdesivir, all are given free of cost. They are spending a lot of money on the, all the quality drugs and latest drugs.
So
Vishnu and
doctors
Kannan.
PP taking care of
for the
patients.
patient to recognize.
Ribhan.
Yeah,
That's Riban actually.
Riban.
That's our inside ICU. Just
That's how the ICU
ICU looks like.
Yes.
I just go on to the previous slide. Actually, you can see on the left side there are ICU blocks are there. There's individual cubicles. When I talk, I will discuss on that. But you will get a picture on that left side the cubicles. So each side they have a 5 cubicle. On the other side there is a 5. That is one, and then it's a corridor there. And the other side it's a U-shaped ICU. Other side again the same thing. And so we have a 20-bedded ICU here. Each cubicle we admit only one patient in a single cubicle, and there is separated by the glass door. Why it is important, I will discuss on my talk.
Okay.
Ashwati.
The nursing station.
Nursing station. This is our new ICU to get started. This is Murdula. He is a neurologist actually, and this inside our ICU just before starting the, as Rohit is with the infection control, and just everything is ready. We are waiting for the first patient. Once the patient is started coming, and then all those are in the scrub dresses, the theater dress has to go out, and only the PP,
Yes,
only the PP will be there.
Okay, that's an interesting slideshow, which just explains how these things are there in the Seven Hills Hospital. And now I invite Dr. Anish Raj to have a. He's still there. He's intensivist and a consultant intensivist in NIMS Hospital of Trivandrum, and he's managing. So he's more talking about the medical management and other managements in the pharmacological management in the ICUs. Dr. Anish, please.
Thank you, sir. Thank you for the opportunity. Actually, we are here from the 1st of June, and we have been managing a 20-bedded ICU under our care. And right now, we are like almost done with our volunteership, and we are planning to leave by 16. So here I'm going to share my thoughts on what we did. So I have made a small slideshow presentation. I will just try to put it up, and we will discuss on that. And we have, first of all, this is just the thought of this thing. Whatever I saw here in Mumbai in the ICU, and I am not going to like tell that this is the scientific thing. This is just the what I learned, and these are the ideas which came into my mind. So first of all, I would like to tell that COVID is a scenario where you have to think out of the box. I'll tell you whatever we don't have much research on this, we don't have a solid treatment for this, so we have to think out of the box. So this is the treatment protocol set up by Kerala and Mumbai. And Mumbai, they have a task force for this. Kerala, we have a task force, and these are the treatment set up by our Kerala and Mumbai. So I hope you can see the slideshow. Everyone can see.
Yes, we can see.
You can see, right?
Yeah.
Yes, yes.
We can see. Don't worry.
Yeah. So this is a basic treatment protocol setup. We have in Kerala azithromycin, SCQ, oseltamivir, lopinavir, tocilizumab, and remdesivir. But we don't have any specifications on antibiotics and steroids. In Mumbai, they have set up like a list, like in the first itself, there is cefosalbutamol, ceftriaxone, oseltamivir, SCQ. Methylpred they have added, and low molecular weight heparin, and lopinavir, ritonavir, and advanced medicine, tocilizumab, and remdesivir, they have added to the protocol. And this here,
Yes, please continue.
Yeah. So this is the ICU admission sheet which we have prepared. These are the first few days. As you can see in the red, these are the people who died, and the white are the people who probably got shifted out and got well, or maybe some of them are still there. So this is the ICU. And so first few days after seeing this, I thought that I should make some changes. And so what I did was that I just thought out of the box, and I had some discussion with Dr. Sajesh also, and we came to a conclusion that we will do some changes. So first I did was from methylprednisolone, I made it dexamethasone for all patients, and I decided to go on for early intubation. Like they used to have a saying that if you intubate, the patient won't come back, and everybody was put on NIV. Even severe ARDS cases were put on NIV. So we went on with early intubation, and I adopted this azithromycin from the Kerala protocol, and I added azithromycin for all patients. And I went on with piperacillin, tazobactam, or meropenem in my ICU. I didn't go for ceftriaxone and all. And whichever patients came in the category, we went for tocilizumab as early as possible, and we also started on remdesivir for all patients as early as possible, and we didn't wait for anything. And favipiravir is a relatively new drug, and I decided to start favipiravir for all moderately ill patients before they start getting sick. Okay, this is a video laryngoscope intubation picture actually. So in the first stage, when we had a lot of deaths, these were the X-rays we saw. So in that COVID ARDS protocol also, we went on with high PEEP, low volume ventilation, and we were getting this picture for almost all patients. So these are just few X-rays. So after that, we had to face a lot of challenges. Some of them like non-theoretical challenges were like staff shortage. We were managing patient in 1:5 or 6. Like one staff will have to take care of 5 or 6 patients, and we have to work in PPE. Fogging of glasses, goggles was a big issue, and you can see in the picture that nothing was clear. You can't see anything. Putting an IV line was like a tremendous job. You can't see anything, and you have to go for a blind IV line. And long hours of working, and we had emotional stress and everything. Like we are separated from home. A lot of doctors had like emotional stress and all. And coming to the theoretical challenges, medical challenges, we had secondary bacterial sepsis. We had to face thrombophlebitis, pneumothorax, multi-organ dysfunction, and thrombosis. All these things are the medical challenges. So how did we deal with the challenges? First of all, what we did was we made it a teamwork. Even we say 1:6. So when I went inside, this 1:6 will become 1:3. I will do whatever a nurse is supposed to do. I will do the basic patient care also, and I will just not like go for rounds and write the notes and come back. I will do whatever the patient needs. Even if the patient wants a urine can also, I will just take and give him. So the teamwork became a very good thing in our ICU. And we did trainings like intubation training, basic patient care training, ventilator training, and I made even our junior doctors capable of managing the ventilator. So, and the emotional support part, we did a lot of emotional support. We did teamwork. We worked as brothers and sisters in the ICU and outside the ICU. We were like a family. Okay, so we took care of the non-medical challenges. And when we came to the medical challenges, prompt ICD. Once we diagnosed pneumothorax, we put an ICD, and we got a video laryngoscope, and we did early intubation. And intubations were done with very nice and ease with the video laryngoscope. And I told you about the venous challenges. If we can't get a line with bit of effort, we'll go for central venous catheter, and we'll go for higher antibiotics. And we had a negative pressure ICU with AHU with proper temperature control, so that we can work in PPE without sweating a lot. So even like 6 hours you work also, you won't get much of a dehydration.
Anish,
And
Anish,
I also
Anish,
started. Yes.
Our moderator, Dr. Iqbal, have to attend a meeting, expert committee meeting today, so he may be leaving in between. I just want to say thanks to Dr. Iqbal for joining us on behalf of everybody, of the panelists and all the participants who are viewing this meeting. Thank you, sir. Thank you very much. Please continue.
Yes. So I also started low molecular weight heparin for all the patients, and also in most of the patients will have some amount of renal failure. So I started instead of LMWH, I started unfractionated heparin for those patients. As you can see, there's a picture in our ICU. Just like Dr. Sadish told, we have separate cabin for each patient, and we were taking care of this AHU in negative pressure ICU. So that was the something we could deal with. So, and we also added on to rehabilitation part. Early enteral feeds were started, trials to feeds or oral feeds, high protein diet, and we also gave aggressive glycemic control for all patients, and we also gave emotional support for the patients. We allowed the patients to carry their mobile phones inside the ICU. They were allowed to keep the mobile phones with them. They can call the relatives. They can even like do video call with the relatives and all. And we also started chest and limb physiotherapy, and we also plan to shift out the patients out of high ICU ASAP. So these were the changes we made, and it started showing up. Like after the start of changes, or whatever changes are made, DEXA, early TOSI, early REM, and even this new drug favipiravir also started showing some results. So this is the admission list after that 10th or 15th of June. I started my admissions list started becoming less colorful. So as you can see, I have many white lines, and many patients are getting better, and our X-rays also started clearing up. These are the results. So I don't have a scientific base for this, but this is what I observed. And whatever highlights I want to say is that we have a very supportive management at Seven Hills Hospital, and we have an unlimited supply of N95, PPE, face shield, and whatever you ask for, you get it. And good nutrition, even for the patients and for us also. We have 24/7 food. If we are taking night duty, we'll get tea and snacks at night, midnight, 12 o'clock, even like early morning, 4 o'clock, 5 o'clock, we'll get food. Every food will be delivered to our ICU also. We can have, the patients can have, and they even, like, I want to emphasize on the nutritionist in our Seven Hills Hospital. She will make special protein smoothie for the NIV patients. Like NIV patients can't have off NIV time, lot of time for having food. So they'll get a smoothie. They can just take out the mask, drink the smoothie, and put back the mask. That was awesome. And 24/7 laboratory support, ABG, inflammatory markers, everything will be done 24/7. 24/7 bedside hemodialysis and radiology support. And we had a very good supportive colleagues. And a special thanks to the Dr. Maharudra, Atsul, and Dr. Smita, who were there to guide us and help us. And they had like given us so much confidence in working in this ICU. So thank you very much. And this is all about my ICU. And we are doing a very good job. And all these junior doctors and everyone, the staffs, they are a tremendous support for us. And thank you very much.
Thank you, Dr. Anish. I would like to thank you for the very good insight you have given regarding the pharmacological management, the team spirit, the teamwork, and everything. Now I would request Ms. Ashwati, she's a staff nurse who has already all the way traveled from Kerala to Mumbai. She was the first batch of nurses who came there. And so I asked her to share her experience in treating the patients in the ICU. Ashwati, please. പറയാവോ?
അറിയാം.
മലയാളത്തിൽ പറഞ്ഞാലും
താങ്ക് യു
മതി.
സർ, താങ്ക് യു വെരി മച്ച്. താങ്ക് യു വെരി മച്ച്. എനിക്ക് ഇവിടെ ആദ്യമായിട്ട് ഒരുപാട് ഓർമ്മകൾ എനിക്ക് പങ്കുവെക്കാനുണ്ട്. കാരണം എനിക്ക് ജീവിതത്തിൽ മറക്കാൻ പറ്റാത്ത ഓർമ്മകളാണ് ഈ മുംബൈ മിഷനിൽ വന്നിട്ട് സെവൻ ഹിൽസ് ഹോസ്പിറ്റൽ ICUലെ കാര്യങ്ങള്. എങ്കിലും ഞാൻ ഒരു കാര്യം പങ്കുവെക്കും, ഒരു പേഷ്യന്റ് എനിക്കൊരു കാര്യം പങ്കുവെച്ചേ പറ്റുള്ളൂ. ജസ്റ്റ് പങ്കുവെക്കാൻ പോവാണ്. ഞാൻ ഭയങ്കര സിക്കായിരുന്നു. പേഷ്യന്റ് ശരിക്കും നല്ല സിക്കായിരുന്നു. പേഷ്യന്റ് ഞങ്ങൾ ട്രീറ്റ്മെന്റ് സ്റ്റാർട്ട് ചെയ്തു. ഒരു 3-4 ദിവസം കഴിഞ്ഞു. നല്ല സിക്കായിരുന്ന ഒരു പേഷ്യന്റ് ട്രീറ്റ്മെന്റ് സ്റ്റാർട്ട് ചെയ്ത് ട്രീറ്റ്മെന്റ് കണ്ടിന്യൂ പോകാൻ തുടങ്ങിയപ്പോഴത്തേക്ക് 3-4 ദിവസം കഴിഞ്ഞ് കഴിഞ്ഞപ്പം പേഷ്യന്റ് നോർമൽ കണ്ടീഷനിലേക്ക് വരാൻ തുടങ്ങി. ഒരു ദിവസം ഞാൻ അവിടെ ഡ്യൂട്ടിക്ക് ചെന്നു. അപ്പൊ ഈ പേഷ്യന്റ് ഓൾറെഡി മാസ്ക് വെച്ചിരിക്കുന്ന കാരണം ഭയങ്കര ബ്രീത്തിങ് ഡിഫിക്കൽറ്റി ആണല്ലോ, ഓക്സിജൻ ചലിക്കുന്ന ഒരു പേഷ്യന്റ് ആണ്. ആ പേഷ്യന്റ് ഫുഡ് കഴിക്കുന്ന കാര്യത്തിൽ ഭയങ്കര ഡിഫിക്കൽറ്റി ആണ്. ഞാനാണെങ്കിൽ അടുത്ത് നിന്ന് ഞാൻ ഉള്ള ടൈമിൽ എല്ലാ സ്റ്റാഫും അടുത്ത് നിന്ന് ആ പേഷ്യന്റ് എങ്ങനെയെങ്കിലും ഫുഡ് കഴിപ്പിക്കാൻ നോക്കും. കാരണം മെഡിസിന്റെ കൂടെ ഹെൽത്തി ആയിട്ടുള്ള ഫുഡും ചെല്ലണമല്ലോ. അങ്ങനെ ഒരു ദിവസം ഞാൻ ഡ്യൂട്ടിക്ക് പേഷ്യന്റ് ഹെൽത്തി ആയിട്ട് ചോദിച്ചു, സിസ്റ്ററിന്റെ പേരെന്താന്ന് ചോദിച്ചു. ഞാൻ പറഞ്ഞു എന്റെ പേര് അശ്വതി അഭിലാഷ് എന്നാണ്. എന്ന് ചോദിച്ചു നിങ്ങൾ എവിടെയാ വർക്ക് ചെയ്യാൻ, വീട് എവിടെയാന്ന് ചോദിച്ചു. ഇവിടെ എവിടെയാണ് വീട്? ഞാൻ പറഞ്ഞു ഇവിടെയല്ല വീട്, ഞാൻ കേരളത്തിലാണ്, ഞാൻ മുംബൈ മിഷനായിട്ട് വന്നതാണ്, ഇവിടെ ഹോസ്റ്റലിലാണ് വർക്ക് ചെയ്യുന്നതെന്ന് പറഞ്ഞു. നിങ്ങളെ ആരാ നയിക്കുന്നതെന്ന് ചോദിച്ചു. ഞാൻ പറഞ്ഞു ഡോക്ടർ സന്തോഷും ഡോക്ടർ സതീഷ് സാർ, ഇങ്ങനെ കുറെ ടീമിന്റെ കാര്യങ്ങൾ പറഞ്ഞു. ഞാനങ്ങ് പോയി. പേഷ്യന്റ് ഭയങ്കര ഹാപ്പിയാണ്, കാരണം റിക്കവറായി വന്നതിന്റെ ഒരു വലിയൊരു ഹാപ്പി. ഞാൻ അവിടുന്ന് തിരിച്ചു പോയി പിറ്റേ ദിവസം ഡ്യൂട്ടിക്ക് വന്നിട്ട് എന്നെ വിളിച്ചിട്ട് പറഞ്ഞു സിസ്റ്ററെ എന്ന് വിളിച്ചു. ഞാൻ അടുത്ത് ചെന്നപ്പോഴത്തേക്ക് എനിക്ക് കയ്യിൽ എന്റെ കെട്ടിപ്പിടിച്ചിട്ട് പറഞ്ഞു, കയ്യിൽ ഇങ്ങനെ പിടിച്ചിട്ട് പറഞ്ഞു അപ്പൊ ഓൾറെഡി പേഷ്യന്റിന് ഫോൺ അലൗഡ് ആണ്. പറഞ്ഞു ഞാൻ ഡോക്ടർ സന്തോഷിന്റെ ഫേസ്ബുക്കിൽ കയറി സെർച്ച് ചെയ്ത് മുംബൈ മിഷൻ എന്നാണെന്നും നിങ്ങളുടെ ടീം എന്നാണെന്നും നിങ്ങൾ എന്നാണെന്നും ഞാൻ ഫോണിൽ കയറി സെർച്ച് ചെയ്ത് ഞാൻ എല്ലാം മനസ്സിലാക്കി എന്ന് പറഞ്ഞു. എന്നിട്ട് പേഷ്യന്റ് ഭയങ്കരമായിട്ട് വയലന്റ് ആവുക. എന്റെ കൈ പിടിച്ചിട്ട് പറയാണ് എനിക്ക് മറക്കാൻ പറ്റാത്ത ഒരു സംഭവമാണ്, കാരണം നിങ്ങൾ ഈ കേരള ടീം, ഈ മുംബൈ മിഷൻ ടീം ഇവിടെ ഇല്ലായിരുന്നെങ്കിൽ ഒരു പക്ഷേ ഞാൻ മരണത്തിലേക്ക് പോയിരുന്നേനെ. എന്നിട്ട് എന്നോട് ഭയങ്കരമായിട്ട് കരയാണ്. കരഞ്ഞിട്ട് ഒരു പേഷ്യന്റിനെ നമ്മൾ ആരാണെന്ന് നമ്മൾ എന്താണെന്ന് പേഷ്യന്റ് ആണ്. അപ്പം എന്നെ വിളിച്ചിട്ട് ഞാൻ നിങ്ങളുടെ സൗണ്ട്, എനിക്ക് ഭയങ്കര ഹാപ്പി ഉണ്ട്, ഭയങ്കര നിങ്ങളുടെ സൗണ്ട് ഐഡന്റിഫൈ ചെയ്താണ് ഞാൻ നിങ്ങളെ ഐഡന്റിഫൈ ചെയ്തത്. അവിടുന്ന് ഞാൻ പറഞ്ഞു നിങ്ങൾ വിഷമിക്കണ്ട, ഞങ്ങൾ അടുത്തുണ്ടല്ലോ എന്ന് പറയാം. എനിക്ക് ഫുഡ് തന്ന് സിസ്റ്റർമാർ, എനിക്ക് നല്ലതായിട്ട് ഫുഡ് തന്ന്, എനിക്ക് കഴിക്കാൻ വയ്യാഞ്ഞിട്ട് സിസ്റ്റർമാർ എനിക്ക് നല്ലതായിട്ട് ഫുഡ് തന്ന്, അതുപോലെ തന്നെ എനിക്ക് കറക്റ്റ് ആയിട്ട് മെഡിസിൻ തന്ന്, എനിക്ക് ഒരുപാട് ഹെൽപ്പ് ചെയ്ത്. ഇവിടെ ഈ ഐസിയുല് എനിക്ക് വേറെ ആരുമില്ല, എന്റെ അച്ഛനില്ല, എന്റെ അമ്മയില്ല, എന്റെ സഹോദരങ്ങളില്ല, എനിക്കാകെയുള്ള എനിക്ക് സിസ്റ്റർമാരും എന്റെ ഡോക്ടേഴ്സും ആണ്. ഇന്ന് എനിക്ക് ഒരു പക്ഷെങ്കിൽ ദൈവം എനിക്ക് മനസ്സിലാക്കാൻ തന്ന ഒരു അവസരമായിരിക്കും, ഡോക്ടർ ആരാണ് നേഴ്സ് ആരാണെന്ന് മനസ്സിലാക്കാൻ തന്ന ഒരു അവസരമായിരിക്കാം. ഞാൻ ഇന്ന് ഒരുപാട് മനസ്സിലാക്കി, ഈ കേരള ടീം എന്നാണെന്നും കേരള മിഷൻ എന്നാണെന്നും എനിക്ക് ഒരുപാട് മനസ്സിലാക്കാൻ പറ്റി. മരണത്തിന്റെ വക്കിൽ ചെന്നിട്ട് ഞാൻ തിരിച്ചു വന്നിരിക്കുകയാണ്, എനിക്ക് ഒരുപാട് സന്തോഷമുണ്ട്. എന്നിട്ട് എന്നോട് ചോദിച്ചു എനിക്ക് ഡോക്ടർ സന്തോഷിനെ ഒന്ന് കാണാൻ പറ്റുമോ, അല്ലെങ്കിൽ നിങ്ങളുടെ ടീം വർക്കിലെ മീൻസ് PP ഇല്ലാതെ എനിക്കൊന്ന് കാണാൻ പറ്റും. ഞാൻ പറഞ്ഞ ഹൈസ്കൂൾ അലോഡ് അല്ല സാറേ, ആരെയും കാണാൻ പറ്റത്തില്ലെന്ന് പറഞ്ഞു. അന്ന് എന്നോട് ചോദിച്ചു എനിക്ക് ഒരു ഉപകാരം ചെയ്യണം, ഞാൻ പോകുന്നതിന് ഞാൻ ഈ ഹോസ്പിറ്റലിൽ വെളിയിൽ പോയി കഴിയുമ്പോൾ എനിക്ക് സിസ്റ്ററിനെങ്കിലും ഒന്ന് കാണാൻ പറ്റണം. കാരണം നിങ്ങളുടെ കരങ്ങള് ദൈവത്തിന്റെ കരങ്ങൾ പോലെയാണ്, നിങ്ങൾ അടുത്ത് വന്നു കഴിയുമ്പോൾ എന്റെ കൂടെ ദൈവം വന്ന് നിൽക്കുന്ന ഒരു ഫീലിംഗ് ആണ് തോന്നുന്നത് എനിക്ക്. അത്രയ്ക്ക് പേഷ്യന്റ് ഹാപ്പിയാണ് സാറേ. അങ്ങനെ ഒരുപാട് ഓർമ്മകളുണ്ട്. ആ പേഷ്യന്റ് ക്യൂറായി വെളിയിൽ പോകാൻ നേരത്തെ കെട്ടിപ്പിടിച്ച് കരഞ്ഞു, കയ്യില് മുറുക്കെ പിടിച്ചിട്ട് ഭയങ്കര കരച്ചില്. എന്റെ അമ്മയ്ക്ക് എന്റെ അച്ഛനും തുല്യമായിട്ടാണ് നിങ്ങൾ ഇവിടെ പ്രവർത്തിച്ചത്. ഞാൻ ഇവിടുന്ന് വെളിയിൽ പോയി കഴിഞ്ഞാൽ നിങ്ങളുടെ കേരള ടീമിനെ എനിക്ക് ഒരുപാട് മിസ് ചെയ്യും. നിങ്ങൾ ഇല്ലായിരുന്നെങ്കിൽ ഒരുപക്ഷെ ഞാൻ മരണത്തിലേക്ക് പോയേനെ. അങ്ങനെ എന്നെ പോലെ നിങ്ങൾ ഒരുപാട് പേരെ രക്ഷിച്ചിട്ടുണ്ടായിരിക്കും എന്ന് പറഞ്ഞു. ഞാൻ പറഞ്ഞു ഉണ്ട് സാറേ, ഞങ്ങളുടെ കടമയാണത്. ഞങ്ങള് ഈ വിവരം അറിഞ്ഞ് ഞങ്ങൾ പെട്ടെന്ന് ഇവിടെ എൻട്രി ചെയ്തതാണ്. ഞങ്ങളുടെ ആ ഒരു കടമ ഞങ്ങൾ നിർവഹിക്കുന്നു, അതിലുപരി ഒന്നുമില്ല. അല്ലല്ല, അങ്ങനെയല്ല, നിങ്ങൾ ദൈവമാണ്, ഇന്നത്തെ ദൈവം നിങ്ങളാണ്, നിങ്ങൾ കേരള ടീം അല്ലെങ്കിൽ നിങ്ങളുടെ മെഡിക്കൽ വർക്കേഴ്സ് ആണ് ഇന്നത്തെ ദൈവം എന്നാണ് പറയുന്നത്. ഞാൻ അല്ല, ഞങ്ങളുടെ ഒരു വർക്ക് ഞങ്ങളെ ഇന്ന് ആവശ്യം ഉണ്ടെന്ന് തോന്നി ഞങ്ങൾ ഓടി എത്തിയ ഒരു സിറ്റുവേഷൻ ആണ് ഇത്. അങ്ങനെ ഞാൻ ആ പേഷ്യന്റിനെ വെളിയിൽ വിട്ടു. പേഷ്യന്റ് ഭയങ്കര ഹാപ്പിയാണ്. പേഷ്യൻസ് പറയുന്നത് ഞാൻ അന്ന് എന്റെ ഫാമിലീസിനെ എന്നെ ഇൻക്ലൂഡ് ചെയ്ത് എല്ലാവരോടും പറഞ്ഞു, ഞാൻ എന്ന് ഈ ഹോസ്പിറ്റലിന്റെ വെളിയിൽ പോന്നോ അന്ന് ഞാൻ ഫേസ്ബുക്കിൽ ഒരു ലൈവ് ഇടും നിങ്ങളുടെ കേരള ടീമിനെ വെച്ച്. അത്രയ്ക്ക് പേഷ്യന്റ് ഹാപ്പിയാണ്. അതുപോലെ ഒരുപാട് അനുഭവങ്ങൾ എനിക്കുണ്ടായി സാറേ. എനിക്ക് ഈ കേരള മിഷൻ, ഈ മുംബൈ മിഷൻ ഇൻക്ലൂഡ് ആകാൻ പറ്റിയതിൽ എനിക്ക് ഒരുപാട് ഹാപ്പിയാണ്. ഞാൻ വരുന്ന സാറിന് മുമ്പേ പറഞ്ഞ കണക്ക് ഞാൻ വരുന്ന ടൈമിൽ എന്റെ ഹസ്ബൻഡ് ഉൾപ്പെടെ ചോദിച്ചു നിനക്ക് 2 മക്കളുണ്ട്, നീ പോവാണോ, നീ മരണത്തിലേക്കാണ് പോകുന്ന പറഞ്ഞപ്പം പറഞ്ഞു ഇല്ല, എന്റെ ഒരു ആവശ്യം ഇന്ന് ഉണ്ട്, എനിക്ക് വർക്ക് ചെയ്തേ പറ്റുള്ളൂ. ഞാൻ വരുന്ന ടൈമിൽ ഞാൻ എയർപോർട്ടിൽ ഇരുന്നാണ് എന്റെ സ്വന്തം അച്ഛനെ അമ്മയെ വരെ വിളിച്ചു പറയുന്നത്. ഭയങ്കര കരച്ചിലൊക്കെ ആയിരുന്നു. എന്നിട്ട് ഞാൻ ഇവിടെ എൻട്രി ചെയ്താണ് ഞാൻ ഡ്യൂട്ടി ചെയ്യുന്നത്. ഇന്നും എന്നെ തിരിച്ചു വിളിച്ചുകൊണ്ടിരിക്കുക. പക്ഷേ എനിക്ക് വർക്ക് ചെയ്യണം, എനിക്ക് എന്റെ ഒരു ഇൻക്ലൂഡിങ് ആവശ്യമുള്ള ഒരു ടൈമാണ്, എനിക്കത് ചെയ്തേ പറ്റുള്ളൂ. എനിക്ക് ഒരുപാട് ഹാപ്പിയാണ് ഈ മുംബൈ മിഷനിൽ വന്ന് ഈ പേഷ്യൻസിനെ നോക്കുന്നതും പേഷ്യൻസ് കെയർ കൊടുക്കുന്നതും. വളരെ ഹാപ്പിയാണ്. എന്റെ ജീവിതത്തിൽ ഞാൻ 10 വർഷമായി വർക്ക് ചെയ്യുന്നത്. എന്റെ ജീവിതത്തിൽ മറക്കാൻ പറ്റാത്ത സംഭവങ്ങളാണ് ഇത്. ആ പേഷ്യൻസ് നമ്മൾ ആരാണെന്നോ നമ്മൾ എങ്ങനെയാണോ ഇരിക്കുന്നത് ആ പേഷ്യൻസിന് അറിയുന്നില്ല. കാരണം ആ പേഷ്യന്റ് എങ്കിലും ഹാപ്പിയാണ്. നമ്മൾ ആ കരങ്ങൾ ആ പേഷ്യൻസിനെ ടച്ച് ചെയ്യുമ്പോൾ അവർ പറയുന്നത് ദൈവത്തിന്റെ കരങ്ങളാണ്, ദൈവം എൻ്റെ അടുക്കെ വന്ന് നിൽക്കുന്ന പോലെ എനിക്ക് ഫീലിംഗ് ആണ് എനിക്ക് തോന്നുന്നത് എന്നാണ് പറയുന്നത്. ഞാൻ വളരെ വളരെ ഹാപ്പിയാണ് സാർ ഇതില് ഈ മുംബൈ മിഷനിൽ പങ്കെടുക്കാനും കോവിഡില് കോവിഡ് പേഷ്യന്റിനെ നോക്കാനും ഒക്കെയുള്ള ഒരു ഭാഗ്യം എനിക്ക് തന്നതിൽ ഡോക്ടർ സന്തോഷ് സാറിനും നമ്മുടെ ടീമിനോടും എല്ലാവരോടും ഞാൻ കടപ്പെട്ടിരിക്കുന്നത്. എനിക്ക് ഒരുപാട് ഒരുപാട് ഹാപ്പിയാണ് സാർ. താങ്ക് യു സാർ, താങ്ക് യു വെരി മച്ച്.
ഒരു നിമിഷം എനിക്കൊന്ന് പറയാനുണ്ടായിരുന്നു.
വളരെ ഇമോഷണൽ ആയിട്ട് തന്നെ രോഹിത് ഒരു സെന്റൻസ് പറഞ്ഞു. രോഹിത്
അതെ അതെ, കാരണം എനിക്കിപ്പോ അശ്വതിയുടെയൊക്കെ വർത്തമാനത്തിൽ നിന്ന് മനസ്സിലാകുന്നത് അത് മാത്രമല്ല, ഇപ്പൊ നമുക്കും പേഴ്സണലി ഒരുപാട് ഉണ്ടായിട്ടുണ്ടായിരിക്കും ഇതുപോലെ ഒരുപാട് കാര്യങ്ങൾ. കാരണം ഈ ഒരു സാഹചര്യത്തിലാണ് നമ്മളെ വേണ്ടത്. നമ്മള് നേഴ്സന്മാര്, ഇപ്പം നേഴ്സന്മാരാണെങ്കിലും ഡോക്ടർ ആയിക്കോട്ടെ അല്ലെങ്കിൽ സഹായിക്കുന്നവരായിക്കോട്ടെ, പക്ഷെ ഈ ഒരു സാഹചര്യത്തിൽ നമ്മൾ ജോലി എടുക്കാൻ നിൽക്കുന്നില്ലെന്നുണ്ടെങ്കിൽ പിന്നെ ജീവിതത്തിൽ ജോലി എടുക്കാൻ പാടില്ല. കാര്യം ഇപ്പോഴാണ് നമ്മളെ വേണ്ടത്. നമ്മൾ എന്താണെന്ന്, നമ്മൾ ആരാണ്, നമ്മൾ എന്താണ് എന്ന് ഇപ്പൊ ആളുകൾക്ക് മനസ്സിലാകുന്നത് ഇപ്പോഴാണ്.
ആളുകൾക്ക് മനസ്സിലായില്ലെങ്കിലും ദൈവം നമുക്കൊരു സിറ്റുവേഷൻ തന്നു. നമ്മൾ ദൈവം ഈ ഒരു സിറ്റുവേഷനിൽ എത്തിച്ചിട്ട് നമ്മളെ ആവശ്യമുള്ള ഒരു ടൈം നമ്മളത് പ്രവർത്തിച്ചേ പറ്റത്തുള്ളൂ. അവർക്ക് ആ കെയർ കൊടുക്കുക. അതാണ്
നേഴ്സന്മാരുടെ മാത്രം കാര്യം എടുത്താൽ പോലും നമ്മളിപ്പോ പണ്ടൊരു സമയത്ത് 20,000 രൂപ
പേഷ്യന്റ് എന്നോട് പറഞ്ഞ ഒരു കാര്യമാണ്. അതായത് എല്ലാവരും അകന്ന് നിൽക്കുന്ന ഒരു സിറ്റുവേഷനിൽ നീ എന്തുകൊണ്ട് എന്റെ അടുക്ക് ഇത്രയും വന്ന് നിൽക്കുന്നത്? നീ എന്റെ തോളി, ഞാൻ ഇങ്ങനെ തോളി പിടിച്ചാണ് വർത്താനം പറയുന്നത്. 55 വയസ്സുള്ള ഒരു പേഷ്യന്റ് ആണ്. എന്റെ തോളി പിടിച്ച് വർത്താനം പറയാനും നീ എന്റെ അടുക്കെ വന്ന് നിൽക്കാനും നിനക്ക് ഒരു ബുദ്ധിമുട്ടില്ല. ഞാൻ പറഞ്ഞു ഒരിക്കലില്ല. ശരിക്കും പറഞ്ഞ പേഷ്യന്റ് അത് പറയുമ്പോൾ എന്റെ കണ്ണിൽ കൂടെ ഒഴുകുന്നുണ്ട്. പക്ഷെ എന്നെ കാണത്തില്ല. നമ്മൾ കരയുവാണോ എടുക്കണമെന്ന് അവർ കാണത്തില്ല. അവര് പറയാണ് നിനക്ക് ഇത്ര ഒരു ബുദ്ധിമുട്ടും നിനക്ക് തോന്നില്ല, ഇത്ര അടുത്ത് വന്ന് എന്നോട് വർത്താനം പറയാനും എന്നെ ടച്ച് ചെയ്ത് വർത്താനം പറയാനും ഒന്നും നിനക്ക് തോന്നില്ല. ഞാൻ പറഞ്ഞില്ല, ഒരിക്കലും തോന്നില്ല. അങ്കിളിന്റെ പപ്പ, മമ്മി, സഹോദരങ്ങളെ, ഫ്രണ്ട്സ് എല്ലാം അത് നല്ല ക്ലിയർ ആയിട്ട് ഞങ്ങൾ ചെയ്യും. അതെന്റെ ഒരു കടമയാണ്. അതോർത്ത് അങ്കിൾ വറീഡ് ആകണ്ട. അങ്കിളുടെ എന്തൊരാവശ്യത്തിന് അങ്കിളുടെ തൊട്ടടുത്ത് ഞങ്ങളുണ്ട്. അങ്കിള് ടെൻഷൻ അടിക്കുക വേണ്ട, നല്ല രീതിയിൽ മുന്നോട്ട് പോവുക. അത് മാത്രമാണ് ഞാൻ പറഞ്ഞത്.
എനിക്ക് പറയാനുള്ളതെന്ന് വെച്ച് കഴിഞ്ഞാൽ നമ്മളിപ്പം ഒരുപാട് സാഹചര്യങ്ങളുണ്ട്.
രോഹിത്, നമുക്ക് മുന്നോട്ട് പോകേണ്ടതുണ്ട്. എനിവേ വി ടേക്ക് ദിസ്. രോഹിത് പറഞ്ഞ ആ ഒരു സെന്റൻസ് ഭയങ്കര സ്ട്രൈക്ക് ചെയ്യുന്നു. അതായത് ഇപ്പോ നമ്മൾ ജോലി ചെയ്തില്ലെങ്കിൽ പിന്നെ നമ്മൾ ഈ ജോലിയുമായിട്ട് മുന്നോട്ട് പോകരുത് എന്നുള്ള ആ സെന്റൻസ് വളരെ സ്ട്രൈക്ക് ചെയ്യുന്നു. I invite Dr. Sajeesh, who is now in quarantine also. He is our chief anesthetist and intensivist. He is working in SP Fort Hospital, Trivandrum. We have been associated with him for a lot of works. We have been moving around with a lot of other missions also. So I invite him to give his insights into the ICU setup and all other things. Please, Dr. Sajeesh.
Yeah, thank you, Santosh. And actually, I was not intended to start with an emotional note, but since Ashwati and Rohit reciprocate their feelings, actually I should I'm just carrying forward that feelings actually. And first I want to say that we worked in an ICU there, and actually ICU through 2-bedded, and myself and Anish was in charge of the ICU. And as Anish said, we do an early intubation and dedicated work. And 2 of our patients, when intubated, normally the high mortality rate is very high, and already we have 2 patients we are extubated, and that is the record in the ICUs all over the ICUs, different ICUs in Seven Hills Hospital. Actually, everyone appreciate Anish for that great effort of bringing back patients continuously from the ventilator patients actually, and from carrying forward from with the emotional feelings also. And I must say that on doctor, I'm not mentioning his name, actually he's working with us, not in the ICU, but one of our patient, when we discussed with the patient, we noticed that the doctor, his grandfather died a few weeks back out of COVID, and just the next day he started working on the hospital, and his father is in our ICU. Still he is working there. Seven Hills. And so many these kind of dedicated fellows are there, doctors are there, so many staff nurses are there. And another one is there on PCA, his name is Kumar, and he is when Normally, the point is that we are very scary with the patients, managing the patients. And he said that putting in this thing, Riles too, he supported me, and he made the patient, because we have a language barrier. The patient only knows Marathi. I can't even communicate with the Hindi, but I can no way in Marathi actually. So he helped me and all, and he said that actually, doctor, the Kerala people are more doctors and staff nurses are very keen on patient management. Normally what happens is that the other doctors, they don't come and they don't even touch the patient. They just give an orders, and you people are there, and we are very happy like that. Okay. So these kind of my colleagues' supports I am keeping in my mind. And when we started the mission, so this is by quotation of Santosh actually. I am very much fascinated with words. There is a professional space in every disaster. This Santosh usually says. Actually, he went to Ebola in Africa, and Ebola at the time of Ebola, he even operated there actually. We know he is an orthopedician and he operated there. He always says that there is a professional space in any disaster. Only thing we have to find out the thing is that my point in my topic point is that ICU setup and protection of healthcare workers, that's the safety of healthcare workers. So in any disaster, first we had a concept there. Then another thing is an individual and group activation, volunteer collection and activation. And third thing is that efficient and safe system. So we have a concept, and we gathered around 100 plus volunteers and doctors and other volunteers, and we started a mission. But the point is that we are going to a new place where how far it is the efficiency and safety are guaranteed there. So we started a pilot trip with Santosh and me started, and we reached around 28, and we reached the 17th hospital. Then we realized that it's a huge structure with around 15 blocks, and each block is a 10-story building. A huge structure, and it was an JC accredited hospital, and it is when MCGM, that's Mumbai Corporation, has taken over it from the March end onwards, and they constructed it as an exclusive COVID hospital with 3,300 beds and ICU. So since it's a JC accredited hospital, they have a provision of around 20% ICU provision. That means around 300 bed ICU they can erect there actually. So the next point is that safety and we decided actually on discussion with the administrators, we decided that we will work on this thing, ICUs and all. Then these ICU safety precautions in ICU and our accommodation and the conveyance. And the ICU, important safety feature in a COVID ICU, as far as I'm concerned, is negative pressure. And what is a negative pressure? We will discuss on that. Actually, ICU there is an AC inlet and outlet. AC throw comes from the inlet and it goes out. It's a passive process actually. And in the COVID ICU, the COVID situation, COVID ICU, the problem is that there is a aerosol generating procedure. Actually, the video shows that there's an aerosol generating procedure in the sense we have a high, you can just see it on the video, that's corridor, and that's inside the cubicle there, as we discussed earlier, that's a cubicle there. Air is not going outside actually. We have created negative pressure there. That's in the corridor, and air goes inside. The negative pressure in the ICU, that means air is sucked out and sucked out from the exhaust with putting a high efficient exhaust fan, and it's sucked out so that aerosol generating procedures, most of our technique in the ICU, that's high oxygen flow, suctioning, and the intubation, extubation, everything goes as high volume of viral particles in there. They can stay there more than hours actually, 10 hours, 15 hours, they can stand there. So that is sucked out from the ICU. And that in the cubicle itself actually. That is one of the major advantages. Then the criteria wise, it should be minimum of 2.5 pascals should be there, and 12 cycles of air change per hour should be there for the ideal one. And actually we got there, we are lucky that we got there around 4 to 5 pascals. That almost double the requirement we had. An excellent negative pressure ICU setup. And another, I should thank Anish that when we started this thing, new ICU, this thing, we took around 4 days to start up. In the sense is that normally what they do is that they just suck out from each cubicle and send discard the air outside, and there is possibility of contamination of other sites and all. What he did actually Arish invention that he is from the common outlet, he put a custom made heavy exhaust fan and sucked out all thing. And of course, we have an AHU, that is air handling unit, and there we have a HEPA in all ICU, and we have a theaters, we have an HEPA, high efficiency particulate air purifier there, and that HEPA, we put in the exhaust, that means contaminated air, we put it on that thing, and the air goes out of the room is full of purified one. That's made by the Anish only. And the thing is that other than the safety point of view, when we go inside the patient, the cubicle and treat the patient, we always, any procedure, we put the gloves and we discard the gloves, and we sanitize with every cubicle. We kept the sanitizer there, sanitize, and comes out. But the point is that when we there in the negative pressure, the efficiency of air comes down actually. So we need, we will be exhausted and all. But the point is that we will take around 5 to 10 minutes for each patient, and at a time actually. We comes out to the corridor, and we kept a trolley there, or the writing or the preparation of drugs, and everything is there in the trolley. So there's a normal AC. That's why Anish said that 6 hour PP is not exhausted there. Then second point is that regarding the safety at the accommodation part. Accommodation, we got an accommodation that's an excellent accommodation, 5-star accommodation. It's a Hotel Lilith. Only problem is that we have some issues with the food, in the sense they provide only vegetarian food. Otherwise, it's a good, excellent accommodation and everything. The conveyance also from the hotel, we are taken to the hospital in a dedicated bus. Actually, we are not supposed to go out and roam around anywhere actually. And in a few days, I realized that the chance of getting infection from the hospital is negligible, actually nil actually. But still, we can get infection from the community. So we avoided all the community contacts actually. But the point is, at some point, we have to buy something like medicines, some tablets, or some fruits, or something, some toiletries, something we have to buy actually. What I personally did was I sterilized everything. Actually, I kept, this is our hospital sanitizer. I still keeping it there. There's plenty of, alcohol solutions we have, and keep in the hotel, and even what are the possible things, fruits and all, we always use, soap and water, washing, and all the things, tablets, everything we wipe with the spirit water. Even the notes, the currency note, we used to sterilize with spirit swab and keep it for the drying. All the coins we wash with soap and water, then only put in the wallet actually. And the other thing is a mobile phone. Whenever the point is that we need mobile phone in the ICU, because with better communication, everything, all the investigations, the X-rays, everything, you will take a photo and send it to our dedicated WhatsApp group is there. So though, even if we are not inside the thing, we can have what is the patient. Actually, even I'm in quarantine, I can see some of my patients are dying because APG is less than 7, pH is coming down, the X-ray is bad, and I used to communicate with Anish that Anish, this patient needs intubation at the urgent, and the patient is dying, because still we are communicating on this. So the mobile phone is very important. So what we do is that we cover all the mobile phones with the coveralls, and what this is this thing, clean drape actually, we put the clean drape or other coverings, or taking the mobile phones and all. And the last point is that the COVID, still we can get COVID in the community. It's very rapid. So what we do is I never went out of the hospitals, any roam around, any purposes. Why? Because two things. The point is that I want to make sure that I want to prove that there is a safe, as I said earlier, there is a safe professional space in a pandemic. That I have to prove that. I have to come out without an infected with the COVID actually. Second point is my position is very important it's a very crucial in the sense, one ICU is managed by two intensives like our ICU, Anish and myself. If Anish and myself in the first week got infected, that means that ICU is closed. Then we don't get any replacement, because intensives is a luxury there in the corona pandemic in ICU situation. We can't get, it's very difficult to get a replacement. So our position is very crucial. So be safe in that position is extremely difficult. And we should do actually then at any cost we have to do. So I'm concluding that we finished around 45 days amidst of the high volume COVID population in a COVID center, having a more than 1,300 COVID patients in a high viral load ICUs actually. If still we are not intact, that is not because of, not just any God's grace, but we followed a dedicated scientific professional strategies actually. It's not a magnanimity from our side. It's a duty of any professional. It's a duty of the professionals to do these things. It's not a magnanimity or our mercy on that. It's our duty. But the point is that if we follow the scientific principles, we have a professional space in any disaster. We just followed our scientific principles. That's why we are successful. We came out, actually we have 45 days, none of them got infected. All of them are intact so far actually. But anyway, we are coming back, but we can get it from the community. But in a COVID center, it's very difficult to get in a pandemic and all in a pandemic positions. The thing is that even in our martial arts, in the school days, we went to Kalari and all. The thing is that if some person is want to hit you with a knife and all, the best position, best safety position, protection position is go close to that patient. The close to the patient, you will get a better chance to survive. You can have a protection there, and that's the best position there. Likewise, any pandemic, rather than running away, you just go close. There is a professional space. We can work on that space actually. I congratulate all my, Rohit, Ashwati and all. They feel the difference of well-established setup. And our area also, our place also, it's coming up. In Kerala, his number is coming up. As Sandor said, we should think of an scientific, well-established intensive care supports. As when the number touches around 10,000, that means we need 500 ICU beds. If that is 20,000, that means 1,000. But that ICU should be unless and it is a very scientific and well-protected ICU, all the chance that we, the health professionals, will get infected. And very difficult to get a replacement of the health professionals. This is very important. Thank you.
Thank you, Dr. Sajesh, for that, both an emotional and so scientific and small nuances and very important things which we usually omit. But I think we need to talk about more of oxygen and all, but we'll come to it later. Oxygen is one of the other important things. So I just I invite Dr. Aparna Krishna. She is a doctor. She has been working, still working there. From the day on, June 1st, she is still working there. So enthusiastic, so powerful lady. I would like to invite her to share her experience in working in Mumbai hospital. Dr. Aparna, please.
Thank you, sir. I hope I'm audible to all of you.
Yes.
Yes. So, like Ashwati sister has told, I would like to share a patient interaction experience from ICU. This patient is a 42-year-old male. He's a police officer. So, like Ashwati sister told, these patients, they are not able to see us. They have no idea how we look like. They always see us in a PPE, written just a doctor, not even our name. So it is only through our voice that they recognize us. So we used to talk at times, and when the patient was getting much better, one day I told him, you are getting better actually, your reports are looking good. So I hope you can be shifted within a few days back to ward. So he was very happy to hear that, and he was telling me, I salute you, ma'am. Because it is only because of you people that I am going to see my family again. And I was like, anyway, you are not going to see your family anytime soon because you have to be shifted to ward. And from there, it will take a few more days for discharge. So he was telling me, no, my wife and my daughter, they are also COVID positive. They are in ward right now. So then I started talking about his family and everything. So he was just the mutual respect we had for each other. I was very happy about it. Even other police officers whom actually we lost in our ICU, we used to talk to their superior officers, IG, commissioner, and everyone. The mutual respect they gave to us. We are all frontline warriors, right? So I was very happy that one police officer was he got well and shifted out from our ICU. And other than that, it is all kind of depressing experiences. I don't want to share it right now. I think that's it.
Thank you.
Thank you, sir.
Thank you, Aparna, Dr. Aparna, for this. She's a good singer also, but just continue. But I'll call just now this next set of slideshow. The second part, so that we can
No slides.
viewers can come.
No slides.
No slides. Okay. Then we continue with the next one. I'll call Dr. Vishnu Pavitran. He is one of my students here. He has been he has studied from Trivandrum Medical College, and now he is working in Kannur Anjalakandi Medical College as an emergency doctor. He is one of the most courageous doctors I have seen. He has he just told me that I just want to come. He never asked me what are the conditions there and all. That's what I feel. So I just want to ask Dr. Vishnu Pavitran to explain his experience, and also he's a very great singer. Maybe a small song. I think I would request him to sing a small song also. Thank you. Please, Dr. Vishnu Pavitran.
Hi everyone. I used to work in an emergency medicine facility at a private medical college, Kannur Anjalakandi Medical College. So I used to teach the interns there. Our team of RMOs there. We used to teach interns there, and there we used to follow a lot of YouTube channels and open source journals to prepare for such training sessions. So there was one channel, it's called Medcram. I used to follow that channel, and one day suddenly when the COVID surge started, the channel actually started a series, a daily update series on COVID. So I used to follow that, and one day my colleague at the medical college, Tejas, Dr. Tejas, he's currently working here. He called me up and asked me, there is something like this, and there is something called Mission Mumbai. We'll have to go there and help them in managing as the frontline COVID treatment people. So the first thing that came to my mind was it was organized by Santosh sir. So when I joined college, Santosh sir was not there. He was somewhere else, and he came into the college after some time. So his introduction was like, first I saw it in the Hindu newspaper, and the introduction was like he was working in some war zone and he used to take some photos. So it was a tremendous introduction for someone like Santosh sir. So അതൊരു ഭയങ്കര ഒരു എക്സൈറ്റ്മെന്റ് ആയിരുന്നു. ഓ ഇങ്ങനെയൊക്കെ വർക്ക് ചെയ്യാൻ പറ്റൂലേ, ഐ ഷുഡ് ഓൾസോ ബി വർക്കിംഗ് ലൈക്ക് ദിസ്, അങ്ങനെയുള്ളൊരു ഇതിൽ വർക്ക് ചെയ്യണം എന്നുള്ള ഒരു ഇതുണ്ടായിരുന്നു. അപ്പോൾ ആൻഡ് ഓൾ മൈ ഫ്രണ്ട്സ് ആൻഡ് പീപ്പിൾ അറൌണ്ട് മീ, doctors around me, nurses around me, they would all jump into something like this whenever something like this comes up. ഇങ്ങനെ ഒരു ടാസ്ക് വരുമ്പോൾ they would all jump into it. They were all willing to work for it. They were all willing to volunteer for anything and any courageous thing. So I was actually in the beginning not very convinced to myself about the importance of what we are actually doing. So it is when some of the doctors here, some of our colleagues here working in other ICUs, they are Mumbai cars, they are from here, they are Mumbai people. So they at some point of time asked us, oh, you guys are from Kerala, so you guys should be very courageous, because nobody comes here, nobody volunteers, and nobody comes willingly to work in a good special facility here. So you guys should be very courageous, and thanks to you guys have come on yourself, and that's a very big thing. So that's when I realized that this was something very important, and there is a very significant value to what we are doing. So that's when it struck me that I should be staying here. So most of the people were leaving after 2 months. They had decided to leave after 2 months. So I was having a confusion, and it was then that I recall the YouTube channels and the open source journals I used to follow. And there is a platform called Slack, and in many Slack workspaces, the research people, research fellows all over the world, they share materials. And the thing is that researchers usually don't reveal their crucial data online. They don't reveal their crucial data without getting a sure, without getting an assurance of it will be accepted and enough peer support will be there. So what I observed was, since this pandemic started, people started sharing the data they have. It was all available everywhere, and internationally everyone started revealing their data, revealing their crucial data, and all the data was uploaded to preprint journals. Like they don't need to be peer reviewed to get published. These preprints are put up in some open source journals like medRxiv and then a bioRxiv. So I used to follow these journals, and it was then that came to my mind that I should be staying here even after everyone leaves. I should be staying here, and I should be doing a case report. Like I can because this is a place in Maharashtra. They have this scheme called Mahatma Jyotiba Phule some Yojana. It is some scheme of the government, and all the treatment facility is given to all the people. Even the high-end medicines are given to people totally free of cost. So especially in this hospital, which is a tertiary care facility, and which is like the best facility all for Maharashtra, everything is available. Like every lab investigation is available. Every medicines, including high-end medicines, are available. Every machinery is available. Staff is available. So I decided to stay here and use these resources to make up a case report to be submitted in an open source journal. So because even high-end medicines like tocilizumab and remdesivir are freely available here, and all these are done according to the protocol with certain out-of-the-box initiatives, and we can procure almost everything that we want, almost everything that we can try out. And I hope in future even N-acetyl-cysteine will be used for treating patients. So if that is also coming, I can use the national protocol and the institutional protocol, and I hope I can make up a case report to be present in some international open source journals. So അതുകൊണ്ടാണ് ഞാൻ ഇങ്ങനെ ഒരു, അപ്പോൾ ഞാൻ ഇത് രണ്ടും കൂടെ നമ്മുടെ ഇവിടെ വർക്ക് ചെയ്യുന്ന നാട്ടിൽ നിന്ന് ഇത്രയും മാറി നിൽക്കുന്നതിന്റെ ഒരു ഇതും ഇതിന്റെ ഒരു റിസ്ക് ബെനിഫിറ്റ് റേഷ്യോ ആലോചിച്ച് നോക്കിയപ്പോ ഇതാണ് നല്ലത്, ഇവിടെ നിൽക്കാം. എന്നിട്ട് ഇങ്ങനെ ഒരു ഇത്രയും കാര്യങ്ങൾ വന്നുകൊണ്ടിരിക്കുകയാണ്. ഇപ്പൊ NAC ഒക്കെ കൂടെ ട്രയലൊക്കെ തുടങ്ങുകയാണെങ്കിൽ നമുക്ക് കുറേ കൂടെ ആ പ്രോട്ടോകോൾസും എല്ലായിടത്തും ലോകത്തുള്ള ട്രയൽസിന്റെ ഒക്കെ നല്ല ഇന്ത്യയിലെ തന്നെ ആദ്യത്തെ ഒരു അവൈലബിലിറ്റി കിട്ടാൻ ഒരു ചാൻസ് ഉള്ള സ്ഥലമാണ്. അപ്പൊ ഇവിടെ നിന്നിട്ട് അങ്ങനെ ഒരു ഇതൊരു ഓപ്പൺ സോഴ്സ് ജേർണലിലേക്ക് കൂടെ ഒന്ന് പാർട്ടിസിപ്പേറ്റ് ചെയ്യാം, അങ്ങനെയുള്ള ഒരു ഇതിലാണ്. അപ്പോ അങ്ങനെ ഉള്ള ഒരു ഇതിൽ ഇന്ന് നിൽക്കുമ്പോഴത്തേക്കും ഇന്നും ചെറിയൊരു കൺഫ്യൂഷൻ ഉണ്ട്. പക്ഷെ ഇന്ന് നമ്മുടെ ഇവിടെ ട്രീറ്റ് ചെയ്തിരുന്ന പേഷ്യൻസിൽ 3 പേര് ട്രീറ്റ്മെന്റ് ആയി, അവര് 2 പേര് നെഗറ്റീവായി, കോവിഡ് സ്വാബ് നെഗറ്റീവായി, അവരെ വാർഡിലേക്ക് ഷിഫ്റ്റ് ചെയ്തു. അപ്പോൾ 4 പേഷ്യൻസ് നിന്ന് ഷിഫ്റ്റ് ഔട്ട് ആയി, നമ്മുടെ ICU നിന്ന് അവർ ക്യൂർഡ് ആയിട്ട് ഷിഫ്റ്റ് ഔട്ട് ആയി. അപ്പൊ ഈ ഷിഫ്റ്റ് ഔട്ട് ആയ പേഷ്യൻസ് ആയത് കാരണം നമുക്ക് കുറച്ച് ടൈം ICU ഫ്രീ ഉള്ളതുകൊണ്ട് അപ്പൊ നമ്മൾ ഈ രാവിലെ ബ്ലഡ് സാമ്പിൾ എടുക്കുന്ന സമയത്ത് ഈ പേഷ്യൻസിന്റെ കയ്യിൽ ക്ലോട്ട് ആയിട്ട് ആ ഒരു ഭാഗം മൊത്തം നല്ല ക്ലോട്ട് ആയിട്ട് ഹാർഡായിട്ട് ഇരിക്കുകയായിരിക്കും. അപ്പോ എന്റെ വർക്ക് എല്ലാം ഫിനിഷ് ചെയ്ത് കഴിഞ്ഞ് എല്ലാം സെറ്റിലായി ഇനിയിപ്പോ അടുത്ത ഷിഫ്റ്റിനുള്ള ആള് വെയിറ്റ് ചെയ്യുന്ന സമയത്ത് ഞാൻ ജസ്റ്റ് ഒരു ത്രോംബോഫോബ് ഓയിൻമെന്റ് എടുത്തിട്ട് എല്ലാ പേഷ്യൻസിനെയും ക്യൂബിക്കിളിൽ പോയിട്ട് അവരുടെ ഈ ക്ലോട്ട് ആയിട്ടുള്ള ഈ കയ്യിലെ ഓരോ പാർട്ടിൽ I just applied the thrombophobe while talking to them. Just because I had some time. സാധാരണ അങ്ങനെ കിട്ടാറേ ഇല്ല, ഇന്ന് അത്രയും ഫ്രീ ആയതുകൊണ്ട് മാത്രമാണ് കിട്ടിയത്. അപ്പോ ദ തിങ് ഈസ് നമ്മൾ ABG രാവിലെ കളക്ട് ചെയ്യാൻ പോകുമ്പോൾ അവർക്ക് ആ സാമ്പിൾ എടുക്കുന്നതിൽ ആ പെയിൻ ഒക്കെ ആലോചിച്ചിട്ട് അവരുടെ മുഖത്തുണ്ടാവുന്ന ഒരു വിഷമം ഒരിത് അങ്ങനെയുള്ള ഒരു ബുദ്ധിമുട്ടൊക്കെ നമ്മൾ കാണാറുണ്ട് രാവിലെ ആ ഒരു സമയത്ത്. അപ്പൊ അവര് ചിലര് കഴിഞ്ഞില്ല അങ്ങനെയുള്ള രീതിക്ക് ചിലപ്പോൾ ചോദിക്കാറുണ്ട്. അവരുടെ വേദന കൊണ്ടാണ് അവര് അനുഭവിക്കുന്ന.
Vishnu, we have to wind up very soon, so please make it fast.
Okay sir. അപ്പോ ഞാൻ ഈ അവിടെ ഉണ്ടായിരുന്ന ആ 18 പേഷ്യൻസിനെയും പോയി കണ്ടു. അവർക്ക് ഓയിൻമെന്റ് അപ്ലൈ ചെയ്തപ്പോ അവിടെ കോൺഷ്യസ് ആയിരുന്ന എവറി സിംഗിൾ വൺ ഓഫ് ദം അവര് താങ്ക്സ് പറഞ്ഞതാണ്. അവര് ഹോൾ ഹാർട്ടഡ്ലി താങ്ക്സ് പറഞ്ഞു. അപ്പോ അപ്പോഴാണ് നമുക്ക് അതിന്റെ ഒരു ഇമ്പോർട്ടൻസും ഇവിടെ നമ്മൾ നിൽക്കുന്ന സർവീസിന്റെ ഇമ്പോർട്ടൻസ് നമുക്ക് മനസ്സിലായത്. ഇങ്ങനെ ഒരു ഓപ്പർച്യൂണിറ്റി കിട്ടുന്നതുകൊണ്ട് എനിക്ക് കിട്ടിയതിൽ ഞാൻ സന്തോഷ് സാറിനോടും സജീഷ് സാറിനോടും നന്ദി പറയുന്നു. നല്ലൊരു എക്സ്പീരിയൻസ് ആയിരുന്നു, വളരെ നല്ലൊരു എക്സ്പീരിയൻസ് ആയിരുന്നു. താങ്ക് യു.
Small maybe like one song please.
Okay. കിളി വന്നു കുഞ്ചിയ ജാലകവാതിൽ കളിയായി ചാരിയതാരിൽ മുടിയ കോരിയ കാറ്റിൻ മധുവായി മാറിയതാരിൽ അവളുടെ നീ കരിമഷിയാലേ കവിതകൾ എഴുതിയതാരിൽ നിലവുകൾ എഴുതിയതാരിൽ അവളെ പ്രണയിനിയാക്കിയതാരിൽ വരമഞ്ഞളാടിയ രാവിന്റെ മാറിൽ ഒരു മഞ്ഞു തുള്ളിയുറങ്ങി മിനിനേരമിന്തിനു തേങ്ങി നിലാവിൻ വിരഹമെന്നാലും മയങ്ങി പുലരിതൻ ചുംബന കുങ്കുമമല്ലേ ഋതുവന്തിനിയാക്കി അവളെ പനിനീ മലരാക്കി. താങ്ക് യു.
Thank you, Vishnu. Actually,
Thank you so
Vishnu, we had plenty of opportunity to plenty of singing Vishnu and all. And another point is I want to mention is that he was our backbone in our ICU. Even though all our colleagues are excellent, everyone is very sincere and committed and all, but everyone depends on Vishnu. Pavitran Chetana is actually the star in our ICU, and actually my job and Anish's job was very easy with Vishnu. Vishnu coordinate everything. He communicate with bystanders and everything. Even though he's not that much fluent in Hindi and all, we take all the responsibilities and the communication, everything he takes. He's a great leader actually.
അപ്പോ അവസാനം നമ്മൾ തീരുന്ന ഒരു ലാസ്റ്റ് ഒരു കൺക്ലൂഷൻ റിമാർക്ക് പറയാൻ വേണ്ടിയിട്ടാണ് ഞാൻ നമ്മള് സാറ് ഇല്ല, ഇക്ബാൽ സാർ പോയിരിക്കുകയാണ്. കൺക്ലൂഷൻ റിമാർക്കായിട്ട് രണ്ടു മൂന്ന് കാര്യങ്ങൾ നമ്മൾ ഈ മിഷന്റെ ഭാഗമായിട്ട് വാസ്തവത്തിൽ ഇമ്പാക്ട് ഉണ്ടാക്കിയിട്ടുണ്ട്. ഒന്ന്, നമ്മൾ കൊടുത്തൊരു റിപ്പോർട്ടുണ്ട്. നമ്മൾ ഈ മിഷന്റെ ഭാഗമായിട്ട് ഞാനും ഡോക്ടർ സജീഷും ഡോക്ടർ അനീഷും ഒക്കെ ചേർന്നിട്ട് ഉണ്ടാക്കിയൊരു റിപ്പോർട്ടുണ്ട്. ആ റിപ്പോർട്ടിന്റെ ഭാഗമായിട്ട് നമ്മൾ റെക്കമെൻഡ് ചെയ്ത ഒരു കാര്യം, നേരത്തെ പറഞ്ഞ പല കാര്യങ്ങളുണ്ട്. ഒന്ന്, ഈ പറയുന്ന ഒരു കാറ്റസ്ട്രോഫി പ്രിഡിക്ട് ചെയ്ത് ഇൻഡീസസ് ഉണ്ടാക്കുക. എപ്പോഴാണ് നമ്മുടെ സിസ്റ്റംസ് ഓവർവെംഡ് ആവുമെന്ന് നമുക്ക് കണക്കിലാക്കാൻ കഴിയുക എന്നുള്ളത് നമുക്ക് നോക്കേണ്ടതുണ്ട്. അതുപോലെ തന്നെ ICU ഡോക്ടർ സജീഷ് പറഞ്ഞ പോലെ ഓക്സിജൻ റിക്വയർമെന്റും നെഗറ്റീവ് പ്രഷറും അതുപോലെ ബാക്കിയുള്ള സ്റ്റാഫിന്റെ റിക്വയർമെന്റ്, ലോണ്ടറി സർവീസ്, ഭക്ഷണത്തിന്റെ കാര്യം, അക്കോമഡേഷൻ, ഇങ്ങനെയുള്ള നിരവധി കാര്യങ്ങൾ ഒരു കമ്മ്യൂണിറ്റി സ്പ്രെഡിന് അത് വളരെ വളരെ ഇമ്പോർട്ടന്റ് ആണെന്ന് നമ്മൾ പറയുകയും അതിന്റെ ഭാഗമായിട്ട് 10 മെഡിക്കൽ കോളേജിലെങ്കിലും ഇങ്ങനെയുള്ള ഒരു സ്റ്റേറ്റ് ഓഫ് ആർട്ട് ICU ഉണ്ടാക്കുവാനുള്ള ഒരു പ്രപ്പോസൽ നൽകുവാനായിട്ട് DME കഴിഞ്ഞ ദിവസം വിളിച്ച് പറഞ്ഞിട്ടുണ്ട്. അപ്പൊ നമ്മൾ അതിന്റെ പ്രപ്പോസൽ ഉണ്ടാക്കിക്കൊണ്ടിരിക്കുകയാണെന്നുള്ളതാണ്. നമുക്ക് നമ്മുടെ ഒരു ഇമ്പാക്ട്, നമ്മുടെ ഈ മിഷൻ മുംബൈയിൽ നമ്മൾ അവിടെ ചെന്നിട്ട് നമുക്ക് കേരളത്തിന് എന്ത് കൊടുക്കാൻ കഴിയുന്ന ഒരു പക്ഷേ അത് ഒരാണ് കാര്യമായിരിക്കും തോന്നുന്നു. രണ്ടാമത്തെ കാര്യം, നമ്മളവിടെ ചെന്നിട്ട് നമുക്ക് ഇപ്പോഴും അറിയാം അവിടെ ഡോക്ടർമാരുടെയും നഴ്സുമാരുടെയും വളരെ ഒരു കുറവ് അവിടെ അനുഭവപ്പെടുന്നുണ്ട്. പുതിയ പല സ്ഥലങ്ങളിലും ഹോസ്പിറ്റൽ ഉണ്ടാക്കിയിട്ട് പോലും അവിടെ ഡോക്ടർമാരും പ്രത്യേകിച്ച് ഇന്റൻസിവിസ്റ്റുകളും നഴ്സുമാരും ഇല്ലാത്തത് കൊണ്ട് തുടങ്ങാൻ കഴിയാത്തൊരു അവസ്ഥയുണ്ടെന്ന് നമുക്ക് മനസ്സിലാക്കുന്നുണ്ട്. അപ്പൊ അതിനു വേണ്ടിയിട്ട് നമ്മൾ വളരെയധികം അവിടെ ശ്രമിച്ചിട്ട് അവിടുത്തെ മന്ത്രിമാരെ എല്ലാം കണ്ടു, സെക്രട്ടറിമാരെ എല്ലാം കണ്ട് അവസാനം അവിടെ നിന്ന് നമ്മുടെ അവിടുത്തെ മഹാരാഷ്ട്ര ബഹുമാനപ്പെട്ട മുഖ്യമന്ത്രി ഉദ്ധവ് താക്കറെ സാറ് അത് അവിടുത്തെ നിന്ന് ഒരു കത്ത് ഇങ്ങോട്ടത്തേക്ക് അയച്ചിട്ടുണ്ട്. നമ്മുടെ ബഹുമാനപ്പെട്ട നമ്മുടെ മുഖ്യമന്ത്രി ശ്രീ പിണറായി വിജയൻ സാറിന് അയച്ചിട്ടുണ്ട്. അപ്പോ ആ കത്തിന്റെ ഭാഗമായിട്ട് ഒരു വലിയൊരു ടീം, ഏകദേശം ഒരു 500 നഴ്സുമാരും ഒരു 50-100 ഇന്റൻസിവിസ്റ്റുകളും ഒക്കെ വരാൻ സാധ്യതയുണ്ട്. അതൊരു വലിയൊരു ഈ പറയുന്ന ഈ സമയത്ത് തീർച്ചയായിട്ടും വലിയൊരു സഹായമായിരിക്കും മുംബൈ. മാത്രമല്ല നമുക്ക് അവിടെ പോയിട്ട് ഈ കാര്യങ്ങളൊക്കെ പഠിക്കാനായിട്ട് വലിയൊരു ഓപ്പർച്യൂണിറ്റി ആയിരിക്കുമെന്നാണ് ഞാൻ കരുതുന്നത്. അപ്പോൾ ഈ മിഷൻ മുംബൈ തീർച്ചയായിട്ടും ഇവിടെ അവസാനിക്കുന്നില്ല. ഇത് ഒരു തുടർ പ്രക്രിയയായിട്ട് നമ്മൾ കൊണ്ടുപോകണം. ഇപ്പൊ ഇതിനു മുമ്പുള്ള കാസർഗോഡ് പോയ ആൾക്കാരും അതുപോലെ തന്നെ ഇവിടെ വന്ന ആൾക്കാർ, നമ്മുടെ ഇവിടെ വന്ന ആൾക്കാരും ഒക്കെ തന്നെ ഇനിയും എന്ത് കാര്യം ഉണ്ടെങ്കിലും ഇതുപോലെ മുന്നോട്ട് അങ്ങനെ വരാമെന്നും എന്തുണ്ടെങ്കിലും വിളിക്കണമെന്നാണ് ആക്ച്വലി ഞാൻ അവിടെ തിരിച്ചു പോകുന്നത്. ഞാൻ ക്വാറന്റൈൻ അവിടെ പോരാൻ നേരത്തെ എല്ലാവരും പറഞ്ഞത് തന്നെയാണ്, ഇനി എന്ത് പ്രശ്നം ഉണ്ടെങ്കിലും എന്ത് പരിപാടി ഉണ്ടെങ്കിലും സാറേ എന്നെയും വിളിക്കണം, ഞാൻ വരാൻ തയ്യാറാണെന്നാണ് എല്ലാവരും പറഞ്ഞത്. ഒരു പക്ഷേ ഈ ഒരു മിഷന്റെ ഭാഗമായിട്ട് ഒരു വ്യക്തിപരമായിട്ട് ഞാൻ കരുതുന്നത് അങ്ങനെയുള്ള വലിയൊരു കൂട്ടം ആൾക്കാരെയൊക്കെ നമുക്ക് നമ്മുടെ ടീം എന്ന നിലയിൽ നമുക്ക് മുന്നോട്ട് കൊണ്ടുവരുവാനും ഇത് ഒരു ഹ്യൂമാനിറ്റേറിയൻ വർക്കിന് നമുക്ക് ഒരു ഈ പറയുന്ന ആത്യന്തികമായിട്ട് നമ്മൾ അവിടെ പോയി നിൽക്കുന്നത് ഒരു പക്ഷേ ഞാൻ എപ്പോഴും പറയുന്നതാണ്, ഒരു പ്രൊഫഷണൽ സ്പേസിനപ്പുറം മുംബൈയിലേക്ക് നമ്മൾ എന്തിനാണ് പോയതെന്ന് ചോദിച്ചു കഴിഞ്ഞാൽ ഒരുപക്ഷെ നമുക്ക് ചെയ്യാൻ കഴിയുന്ന വളരെ കുറച്ച് കാര്യങ്ങളായിരിക്കാം. പക്ഷെ അവിടെ പോയി ആ പ്രശ്നം അനുഭവിക്കുന്ന ഓരോ മനുഷ്യന്റെയും കൂടെ നിൽക്കുക, അവരുടെ കൂടെ നിൽക്കുക, അവരുടെ കൈ പിടിക്കുക, അവരുടെ ദുഃഖത്തിൽ പങ്കുചേരുക എന്നുള്ളതാണ് ഒരു മെഡിക്കൽ പ്രൊഫഷണലെ സംബന്ധിച്ചിടത്തോളം ആത്യന്തികമായിട്ടുള്ള ഒരു കാര്യം. അല്ലാതെ നമ്മൾക്ക് ചെയ്യാൻ കഴിയുന്നത് പരിമിതമാണെങ്കിലും ആ ദുഃഖം അനുഭവിക്കുന്നവരുടെ കൂടെ നിൽക്കുവാനായിട്ട് നമുക്ക് ഇത്രയും പേരെങ്കിലും മുന്നോട്ട് വന്നത് വളരെ വളരെ നല്ല കാര്യമാണ്. അത് ഇനിയും തുടരാൻ നമുക്ക് സാധിക്കുമെന്ന് മാത്രം പറഞ്ഞുകൊണ്ട് എന്റെ വാക്കുകൾ അവസാനിപ്പിക്കുകയാണ്.
Santosh, you are mentioning about the oxygen. I just promised that you were telling about
ഓക്സിജന്റെ കാര്യം ഞാനത് വീണ്ടും ആ കാര്യം മാത്രം പറഞ്ഞുകൊണ്ട് അവസാനിപ്പിക്കാം. പ്രത്യേകിച്ച് ഈ ഓക്സിജന്റെ കാര്യം വളരെ ഇമ്പോർട്ടന്റ് ആണ്. കോവിഡ് ഹോസ്പിറ്റലിനെ സംബന്ധിച്ചിടത്തോളം ഒരു ICUവില് ഒരു 10 to 15 ലിറ്റേഴ്സ് ഓക്സിജൻ എങ്കിലും ഒരു പേഷ്യന്റിന് വേണ്ടി വരുന്ന ഹൈ ഫ്ലോ ഓക്സിജൻ തെറാപ്പീസ് ആണ് നമ്മൾ നടത്തുന്നത്. അപ്പൊ അങ്ങനെ ഒരു തെറാപ്പി നടത്തുമ്പോൾ സാധാരണ നമ്മുടെ ICUയുടെ റിക്വയർമെന്റിനെ കാട്ടിയും 10 മടങ്ങ് ഓക്സിജൻ ഇത് വേണ്ടി വരും. അപ്പോ ഒരു 100 പേഷ്യന്റിന് താഴെയാണെങ്കിൽ നമുക്ക് ഈ സിലിണ്ടറിനെ കുറിച്ച് ആലോചിക്കേണ്ട കാര്യമില്ല. ജംബോ സിലിണ്ടേഴ്സ് കൊണ്ടൊന്നും ഈ പറയുന്ന ഇത്രയും വലിയൊരു വോളിയം നമുക്ക് നൽകാൻ കഴിയുകയില്ല. മറിച്ച് ഇത് ചെയ്യാൻ പറ്റുന്നത് ലിക്വിഡ് ഓക്സിജൻ ടാങ്കുകളാണ് നമുക്ക് ഏറ്റവും അത്യാവശ്യം. വലിയ ഹ്യൂജ് ടാങ്കുകൾ തന്നെ ഇത് ലിക്വിഡ് ഓക്സിജൻ സപ്ലൈയും പൈപ്പ് ലൈൻസ് വഴിയുള്ള ഈ പറയുന്ന ഓക്സിജൻ സപ്ലൈ മാത്രമേ ഇത്രയും ഹൈ പ്രഷറിൽ ഹൈ വോളിയത്തിൽ നൽകാൻ കഴിയുള്ളൂ. 100-ൽ കൂടുതൽ പോകണമെങ്കിൽ പലപ്പോഴും 2 ടാങ്കുകളെങ്കിലും വേണ്ടി വരും. അപ്പോ അങ്ങനെയുള്ള സെറ്റപ്പ് ആയിരിക്കണം നമുക്ക് വാസ്തവത്തിൽ നേരത്തെ പറഞ്ഞ ഈ ഓക്സിജൻ റിക്വയർമെന്റ് അനുസരിച്ച്. ദാറ്റ്സ് വെരി വെരി ഇമ്പോർട്ടന്റ്. നമ്മൾ ഉണ്ടാക്കാൻ പോകുന്ന എല്ലാ ICU സെറ്റപ്പിലും തീർച്ചയായിട്ടും
we need a high efficient, state of art, high quality ICUs with all the safety precautions that are addressing the high volume oxygen requirement, oxygen tanks. And you mentioned about the laundry and everything, including food and everything. That kind of a comprehensive ICU concept, at least 4 or 5 centers in the Kerala should be built up within a span of 2 to 3 months, because we are expecting a huge number of patients coming here. That should be the goal. And actually the government of Kerala has taken up, as you said that you mentioned it, but since concluding on that point is that when they are ready to construct these tents in all the 10 government medical colleges, the state of what ICUs they're ready to construct, and given the proposal also. And Santosh is invited. Say after the mission, one of the major advantage is that first-hand those who are having the first-hand information like us, and even in our ICU, until date we have treated more than 100 patients, and we have a data and everything about all the ICUs for the last 2 months. We have all the data of other different ICUs, 6 ICUs, all the ICUs we have. And this kind of Anisha has an immense experience. This kind of experience, with experience, they are recognizing it as they included Santosh in the expert committee, and we can contribute a lot on the Kerala high quality healthcare as far as the COVID ICU is concerned.
Okay. So last sentence, I would say that the most interesting and very wonderful thing is that our Kerala, the Mumbai mission team is mentioned in the letter which has been gone from the CM of Maharashtra to CM of Kerala. That has been, I think, the wonderful achievement which we have done. We have been mentioned in the letter as we have done a great job. Thank you
We
all
appreciate
for
it. Government of Maharashtra has appreciated.
1 minute.
Yeah.
1 minute, sir.
Finish.
1 minute. 1 minute, sir.
Okay. Tell brief.
Please.
Yeah, sir. നമുക്ക് കേരളത്തിനാണ് ഒരുപാട് പഠിക്കാനുണ്ട് ഇപ്പൊ മുംബൈയിൽ നിന്ന് ഈ ഒരു സാഹചര്യത്തിൽ. അപ്പം എനിക്ക് പറയാനുള്ളത്, ഇനി നമ്മുടെ നാട് ഈ ഒരു സാഹചര്യത്തിലോട്ട് പോകാൻ പാടില്ല. അപ്പം അതിനുവേണ്ടി ഗവൺമെന്റ് പറയുന്നത് എന്താണെന്നും ആരോഗ്യ പ്രവർത്തകർ എന്താ പറയുന്നതെന്നും കേട്ട് വേണം നമ്മൾ ജീവിക്കാൻ ഇനി അങ്ങോട്ട്. അപ്പോൾ എല്ലാവർക്കും നന്ദിയുണ്ട്. പിന്നീട് നമുക്ക് ഇനിയും ഓരോ കുടുംബങ്ങളെയും കൈപിടിച്ച് ഉയർത്താമെന്ന് വിശ്വസിക്കുന്നു. അപ്പൊ എല്ലാവർക്കും എന്റെയും ഞങ്ങളുടെ ടീമിന്റെയും നന്ദി. താങ്ക് യു സോ മച്ച്.
എന്താവശ്യത്തിനും ഞങ്ങളും ഉണ്ട്. ഞങ്ങൾ സാറിന്റെ ഒപ്പം ഉണ്ട്. ഏത് പ്രവർത്തനത്തിനും ഞങ്ങളുണ്ട് സാർ.
So we are winding up the Zoom webinar. This is the third webinar series from the AMUSEUM Art Science. Actually, hearing this, AMUSEUM is thinking that with the individual capacity of certain people, certain groups, certain friends, have been able to elaborate their circle and widen their circle to such a level. We have to think to make this activity in a way of like an institution, so that it will make more collaborated activities, more support, and more financial support from government or any other agencies. So that I think Dr. Santosh, Sajeev, and all this team should think about making this into a type of system to function and sustain. And AMUSEUM is thankful to Dr. Santosh Kumar SS, Dr. Sajeev Ji, Dr. Anish Raj, Dr. Vishnu Pavitran, Dr. Aparna Krishna, Rohit Krishnan S, Ashwati Abhilash, Anu Devarajan, and moderator Dr. B. Iqbal are joining this webinar, and all other volunteers who are still working and worked at Mumbai COVID Hospital with this team. And we would also like to thank all the attendees. We have more than 100 attendees in this session. We would like to thank all of them for spending time with us. Thank you.
FBBS also.
Thank you very much.
Thank you.
We'll go.
Yeah.
We are going to end the meeting.
I am already on the move.
Thank you, Ajit, for hosting.
And thank you. Thank you to all the FBBOs.
Thank you, Ajit. Thank you all the attendees.
Viewers also. Thank you.
Bye.